Call the meeting to order for Tuesday, May 22nd, 2018, Wicomico County Council open work session for Wicomico County Council fiscal year 2019 budget. I'd like to ask everybody to stand for the Pledge of Allegiance, please.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
First item on the agenda is the HR Department, Human Resources. Good morning.
I have guests from Care First.
Oh, good.
Guests from Care First. Join me.
Thank you.
Thank you so much.
Sure.
We can share.
Do you need, we have plenty.
I've read through it.
You'll need it as employees.
Thanks.
What I would say, if you could, please just introduce yourself so that the public knows who you are, who you represent, and make sure that you have a microphone. We only have three in front of you, but make sure you have a microphone when you speak, just for the record. Thanks.
Good morning. I'm Jean Sewell. I work at Care First Blue Cross Blue Shield. I'm the account executive that handles and manages the relationship here with the county, as well as many of the municipals on the Eastern Shore.
Great.
Wayne Strausburg, Director of Administration.
I don't know which microphone. Mary Penzick, I'm a Senior Director for Care First Blue Cross Blue Shield, and I am responsible for the overall municipal market public sector accounts in the state of Maryland.
Okay.
And I'm Michele, Ennis, the Director of Human Resources.
All right. I'll let you start if you'd like, Michele.
It was our understanding that you wanted to discuss health insurance. So what we have been doing in Human Resources is we have been going out to all employees to discuss health insurance changes. As of this morning, I've seen approximately over 90% of the workforce. In all those meetings, and the packet which we handed out is the same exact packet that every county employee is receiving. What I have done is I've started every meeting by discussing the history, what's going on. Well, we went to go renew with the annual budget, and what our quote from Bolton Partners, who is also our account representative, was the county was going to experience a 17 to a 20% increase in health insurance premiums, which was huge. 20% would equal $2.5 million, $2 million on the county, which is very concerning. We began to compare that to prior years and prior settlements, and that was a significant jump from prior years. Last year, I think we were approximately in a deficit of $101,000, which is approximately 1% of our premium, where the year before we had a surplus and employees had experienced a health holiday, where we split it back up, or in prior years. So we began to look at why, and when we looked at the data, we noticed that the claims were in the last couple quarters that we were leading up to. We are approximately in the current year at that point around $1 million over actual premiums received. So how health insurance works is this. Us as an employer and you as an employee, you pay a premium in your paycheck. Then the premiums, because we're self-funded, are netted together with the actual cost. In the end of the year, with your administrative fees, you either have a surplus or a deficit. If you have a deficit, we have to pay the excess out of our reserves. If you have a surplus, it's refunded back to us. Well, to date, we were looking at, right now, our claims being actually 20% higher. So what do? Employees want a raise, and on top of that raise, they're going to hear you're going to have I'd say midway 18% increase in your health insurance. That's not a good message. Employees don't understand that. They also don't understand that it's your actual usage. They don't understand how it works. They don't, it's just that the cost of medical is going up. So, over the last couple of weeks, I have spent going out to every department and every employee, educating them. And I've made sure I've seen every department, every employee. So, how it began, so what we did, we looked at the data, and then we also looked at, okay, who is it? What is it that's causing this, or what is our utilization? One of the things we noticed that is that a majority, we have 1,500 individuals. 1,200 of those individuals are on a PPO plan, where 300 of those individuals are on an EPO plan. Do they know the difference? No.
You said, what was the difference?
They don't know the
No, I know.
difference.
How many people are what?
There's 1,200, and approximately 1,200 people on a PPO plan,
Right,
and remaining 300 are on an EPO plan.
okay.
The problem is the employees don't know the difference. They think that they actually don't, they mistake a EPO as being an HMO, needing referral. It's not true. It's the same network. It's the same identical network, same identical doctors, same everything. The only difference between a PPO, being that I've been explaining they're both preferred. A PPO and an EPO is, a PPO is you can go out of network. And an EPO, you must stay in network. There's thousands and thousands of doctors in the whole network. It's hard to go out. So we looked at the data and said, okay, of our PPO users in the claims, how many claims are out of network? We had $8 million of the PPO claims, only $40,000 are out of network. Our employees are paying for something they're not using. Out of 21,000 doctor visits, professional visits, and I think I put that in your budget message, or the actual summary of it, out of 21,000 doctor visits, only 188 of those visits are out of network. It's actually explained to me in working with our representatives that to be out of network is really a specialization, something hard, some rare, and you can still appeal it. And also what they explained to me this morning is if you're out of state or something happens in emergency, Care First will still cover it if it's an EPO. So looking at that and looking at the difference in the cost, to us, shifting it is Band-Aiding the problem. We're Band-Aiding the problem this year in order to look at raises. We're Band-Aiding the problem in order for it to be affordable. Because my job is to find the most affordable, highest quality coverage that there is out there. So I'm going to take you through the packet that I've been taking the employees, because basically where we're going with this is the county is going to supplement the EPO plan. Just like the city of Salisbury, just like Somerset County, just like what's being done out there.
Excuse me. You say that it's this is the Band-Aid?
It is a Band-Aid.
Well, but then again, I mean, not to discount that either. I would think that that's maybe all that's required until we get back on a different level, because it seems as if the increases have occurred because of a minimal number of extreme cases that have put a strong burden on the overall costs.
Yeah, it's about...
What's the time frame for when that goes away?
Well, I mean, I'll let these two ladies explain that, John, but you're right. We have about 20 cases that are extremely expensive cases, and they have generated the loss, if you will.
Sure.
By migrating from the PPO option to the EPO option, we reduce the premium quite a lot. What we need to do in order to, if we wanted to go back to a PPO, and personally I looked at it from my standpoint and looked at, the doctors that are in the EPO network, I looked at the prescriptions, that type thing, and I looked at it and said, I don't really see any difference other than if you had something extraordinary that required treatment that was not available inside this network, but you still have an appeal right. So I think given the amount of money that both the employees and the county would save, I think it's a good move right now. In order to minimize our exposure going forward, what we really need is a healthier workforce. I mean, that's what's driving this, that we have some significant health issues, maybe not broad spectrum, but we have some very, very serious illnesses that have to be treated, and insurance companies don't lose money.
And what I've explained to every single employee, and I told them, I said, health insurance is like auto insurance. You use it. We want you to use it. We want you to use it to get your wellness. We want you to get your annual checks. We want you to find things early and before it's more costly. I've made that message very clear. We need people to go get a primary care. We need people to go to your annual wellness checks. We're exploring options for next year to kind of make it an incentive for employees to go get those well checks.
If the, I don't know, go ahead, Larry.
I just want to know, are you familiar with how many employees do not have a primary care physician? Because I know a lot of them like to go to the emergency room as their primary care.
These ladies can,
We actually have that data.
we've looked at
And
that.
that's.
And it's increased. We've actually increased as we educate employees.
You
And
mean
I think, yes,
they're
we are,
getting doctors?
that
is
people
a good
getting
thing.
primary cares.
Because I know in the past, that'd been a problem with the city, the Board of Ed.
Correct, Larry.
When they need a doctor, they go to the emergency
They
room, no
use it
matter
in
what
which-
the situation was.
And in part of this packet, you'll see, there's options, there's alternatives to going to the emergency room, costing themselves higher deductibles, costing the plan higher.
Right. I think it's $100.
Yeah, generally speaking, also, Larry, we have a significant trend, negative trend, if you will, in type 2 diabetes.
Yes.
And that's driven by obesity,
And that's a
essentially.
healthcare issue.
And that's a healthcare. So there's a component of this that has to do with the health and the health habits of our employees. So we're trying to migrate to something that gives our employees essentially the same coverage, cost them in the county less. Our focus right now is to determine what things we can do in order to promote better health habits amongst our employee workforce. That's critically important to us as we go forward, because our age census is skewed towards people. They're not as old as me, but
Thank God.
thank God, right? But
About 82% of your population actually is associated with a primary care provider.
That's actually.
Yeah.
So
That's pretty
meaning
good.
We've
that
just
they've
increased
had some type of preventative or visit with a primary care, well, it could be geriatric, pediatrician. So you're actually, those numbers actually look fairly good. Could we make them better? Certainly. We need to encourage people to make sure they're associated. And you want them to have that primary care provider now, not when, oh, I had to go to the ER and now I need one tomorrow or next week, because you're not going to get in. We actually have a very good network of providers, but they're busy. They're busy. Your ER utilization is actually down, which is good. We did a campaign with the city, and the city really, because their numbers, we thought we could tackle that, and they improved as well.
Falls back on
So-
education.
Yeah,
Yeah.
and to comment on the ER going down, and I don't want you to assume that they're not attributed to a PCP, that they are automatically going to the ER. Those folks really could be under the care of a specialist, like a cardiologist and things like that, and they may not.
But, and one reason, like I said, and one thing that really concerns me is I don't want this person who's 42 years old having chest pain to be afraid to go to the emergency room.
No,
Absolutely.
you need to go.
Absolutely.
If you need to go, go.
And-
But
Absolutely.
And to Wayne's point, your population, the folks that are on the plan, more than 50%, greater than 50% of them have at least one chronic condition. Diabetes, high blood pressure, high cholesterol, something. So, to Wayne's point, we just really need to put an emphasis on getting people leading healthier lifestyles.
I agree.
No. The phrase that you used, Band-Aid, why wouldn't we stay with this plan? It's obviously cheaper, and you're saying there's no problems
we're
with
not
it.
leaving it, the plan.
Well, I mean, you had suggested that maybe we would
No, I'm
have...
saying they're paying for an option, they're paying for a PPO option at a much higher cost than at an EPO option, and they're not using, everybody's staying in network. Over 99% of our employees are in network at doctors.
I get all that.
So, it's costing our employees less to move. I'm on EPO, I'm gonna feel the increase. I have nowhere to go.
What do you mean you're gonna feel the increase?
My premium is gonna increase. So if you're currently on EPO, those 300 people, you're going up, our final negotiation was 16%. You're going up 16%. But if you're on a PPO, and that's why I was gonna go through these numbers, you can actually move to an EPO option and only go up $1. So, I'm saying the cost of having an EPO contract is less, and that our employees are able to move to that coverage this year and not feel a significant increase.
The
But next
majority.
year, if we're still unhealthy next year, yeah, absolutely, I'm gonna be out there saying, I'm sorry, we're going up 20%.
Well, I'm really confused here.
I think we should stay.
Yeah.
I think we should stay with this construct, John.
Yeah.
I think the county covering the EPO at the traditional percentage split that we've covered health premiums should stay in place. I think people who, for whatever reason, want to stay with PPO and pay more money for that coverage, I don't necessarily think that we want to block them from doing that, but I can't understand why they would want to do it, because
They can keep it.
it's
think
about
there's-
1.8%.
Yeah, it makes
Of our
sense. It makes
claims,
sense.
yeah.
I guess my question really, I mean, the long and short of it is, going from a
Right.
PPO to an EPO as a large, as standard,
Right.
what cost does the county, what additional costs will the county incur? What savings will they incur? And the same for the employees. You got two things here. What's
Right.
happened to the county, what's happened to the employees?
I think our premium increase is
Yeah,
$656,000.
that's what it was gonna be $2 million.
Right.
And we were able to decrease that to 600,000.
Now, that's
And that's,
a $656,000 increase over last year.
Understood.
But what we're saving is about $1.4 million
Right.
by
educating employees.
transiting
Yes.
Okay, so
from the old
now,
construct.
great, now the employees, what
Yeah,
is,
I gotta
what
let them-
happens with them?
The employees, actually, I've met with 90% of the employees, and they have actually received emails, and they thanked me for the educational session because they didn't know. When they first came with the county, it's changed since 10 years ago when some employees came. A PPO is different. They didn't realize it was the same network, so.
Well, to
employees-
answer your question, John, Michele, someone who was already in EPO and
PPO.
had,
Well, if I could go through the packet.
Yeah, family
I
cut.
think if I could
I
go
think
through the
what they
same
wanna do is
packet,
see
it would
that.
clarify,
Yeah.
just like it did
Okay.
with employees.
do that.
Okay, so let's go through it. This is actually what every employee has received. On this first page, follow along with me. Everybody with me? Up here you see going from the right to the left, the first box, okay? On the right-hand side is what we are currently paying. The top box is the total contract, is our actual total contract. On the left-hand side is our renewed contract as of actually September 1st, August paycheck, okay? We've been working off of the center box when I'm talking to the employees, because most employees want to know what's going on with me, what's going on with my paycheck, and it's easier for everyone to comprehend. All right, so going down in the second box, you see PPO active. Everybody with me? Your individual coverage is $91.41. When we actually renew in September, the new rate will be $175.61. However, if the employee moves to EPO, their new rate will be $92.52 a month, which is only a $1 increase. The biggest saving, let's look at husband and wife. We have a lot enrolled in husband and wife. Currently, they're paying $343.84. When we renew the contract, the employee share will be $506.91. If they move to an EPO, their new premium will be $306.79, which is a $40 a month savings. And last, family plan, currently $373.31. If they move to if they stay on the PPO, it'll be $348.81. If they move to an EPO, $399.30. So they're gonna go up $20. So that's the impact on the actual employee. Now, what I've been telling employees to do is to go to page 15. There's something called My Account. Over there? My Account. We ask employees how many people have actually signed up on My Account. We've been told there's coupons, you can get gym discounts, so forth. But if you go to page 16, there's something on the Care First webpage and it's also on my account, says find a doctor. You can go on this link and search within a 30-mile radius any doctor, and hundreds will pop up. I've been doing it for employees all week. And it goes by what you're looking for, what kind of coverage you're looking for. Are you looking for primary care? Are you looking for some specialist? All their doctors, they can go up and find that their doctor is showing up in network. Right next to that, there's a little box, whether they're in network or not, and it also says, it'll tell you if they're accepting new patients. So we've asked all employees to go here, look, and they have. And our feedback is they've successfully found that their doctor's on there. Some have called Care First directly, the customer service, and said, please look at my doctors for the past year. Have I been out of network? No. Majority of the doctors are in network. So we also, if you keep moving, page 21, employees worry about travel. They worry about, okay, what if I'm home and I don't, everything's closed. It's nothing significant. You're not having a heart attack. It's just you have fever, ear infections, flu, cold, allergies. Where there's actually, if you download your app, you can download this app on your phone. You can do a video visit with a doctor. And it's not $49, it's your $15 copay. This is just your literature for All Care First. And they can call in a prescription. You're able to go pick up the prescription, be seen, you're able to stay out of the emergency room.
What if it is a heart attack and things like that?
Then go to the emergency room. Yeah, but
I mean, who's paying?
who's paying?
Yeah, I mean, does this coverage cover it if you're out of town and?
Yeah, every hospital in the nation is covered by Care First. You're not going to run into a hospital that does not take care, or and even in emergency, they will cover.
Doctors in that hospital?
Yes, yes. If you have an emergency, they will cover it.
Are they in your network?
Yes.
So in your network doesn't just, I don't go that much either, fortunately. In network doesn't mean in this community.
No,
No,
Could be in
all
California.
over
it's
They
their
could be in
U.S.
national network.
I actually have dependents in Alabama that uses the EPO coverage, no problem. $15 copay. I got a second one going in the fall. No problem. I thought I had to switch, and I was worried that I didn't because I was worried I didn't switch. Oh no, she got sick. Now go to the intermediate care. They called me up, $15 copay. Taken all over. They called in their prescription over at Walgreens, CVS, Walmart. They're usually all over the U.S.
I want to say it's like 92% of all providers across the nation are in the Blue Cross Blue Shield network.
Okay.
Okay, on your next page, page 23, there's a side-by-side comparison. What is EPO and PPO? Basically, we've asked employees, and we're asking you to look at this. What do you use the doctors for? What is the differences? The biggest difference we found is chiropractic visits. If you're on an EPO, you can only go to the chiropractor 20 times a calendar year versus unlimited with a PPO. Now, this is different, just going to a chiropractor and something being work-related and workers' comp. So there's 52 weeks in a year. We have not heard of anyone exceeding those limits. We've also see a difference in, speech therapy and occupational. And that's limited to 50 visits a year per calendar year, with a higher copay. And next page, it gives a summary of preventative services. These are no copays. We encourage employees to know your preventative services, get checked. Get yourself screened. So this is the basic packet. This packet has everything. There is no changes to the dental. There's no changes to the vision. There's no changes to the dental. There's no changes to copays. Everything's the same structure. It's basically understanding it's the same network.
How about prescriptions?
Prescriptions is its own plan, and we're getting ready to go through prescriptions. That's a whole separate, we're trying to get people to understand medical first.
Is there a particular, you say that, you said what percentage were in network? 90?
98.
You're
Like
98.
98.7, yeah.
Okay.
Actually, I have it right here.
Are there any
We're
particular
99.8.
specialists that are not in the network? In other words, is there any type of characterization that you could make where you said, these doctors are usually not in the network?
And not only are they not in our network, but they're probably not in anyone's network.
Really?
Behavioral health. Sometimes we have behavioral health We do have, I just had a case where a Lyme disease specialist, something very specialized.
Which they can appeal.
Correct. They can appeal that, like, in other words, there's not any other providers in the area, that kind of thing.
Okay.
And we are always very actively, particularly with behavioral health
Right.
and substance abuse,
Yeah, 'cause that's
we
become
have
so
a real
huge.
aggressive, out trying to recruit folks into our network.
Okay, that's good.
Yeah, so we're aggressively doing it.
Does everyone go with health insurance when we talk about prescriptions?
So what does the employees need to do to change?
Actually, here's a form. Sorry, I missed that. This is very important, especially those on PPO, if you want to move. Here's a form that Human Resources is asking all employees to fill out. You must have this form filled out to Human Resources by July 27th. Open enrollment, unless there's a life change, is only once a year. If we don't have the form, they're stuck. They're stuck with a new premium. So we've been collecting them on site. We've been collecting them anytime open, and last date, deadline date, July 27th. So we ask all employees that they go, they do the research, go look at your doctors, go look at your utilization, and make the best choice for yourself.
And we'll follow up and be sure that we
We-
keep reminding our employees that, especially the employees that are in PPO, hey, if you want to
We're
make
at-
the switch, please get your election form in.
What we're going to do is we're going to pull a list at the beginning of July because we're tracking changes. So far, we've had a couple hundred changes, 170 some changes. And we are going to pull a list at the beginning of July and go back to those PPO employees and say, hey, look, it's up to you. Do you want to stay? Don't forget, because, yeah.
So if you have an employee that's questioning what the difference is going to be between what their out-of-pocket cost would be, whether they're covered for the care they need or for the prescriptions they need, can you research that and show them what's going to change for that one person?
We've been helping employees, yes, go through, or they've been calling the one,
Care
their
First to
Care
do that
First
too.
directly and having them look at their whole claims history
Okay.
and look at the payments to kind of certify, oh yes, all your claims over the past year or two have been in network, have been covered.
So they
And-
don't have any big surprises?
No.
things like
Correct.
that.
When I actually first moved, I didn't feel anything. And a lot of state employees come to the county, and of course, all the city employees that employ with the county, they come from EPO and stay on EPO, no difference, none.
And the employee could do it on their own as well.
Yes.
Going into my account, you can literally see a history of everything that you've done for the year.
Yeah, so we'll
Well,
help
when we
you.
talk about the prescriptions,
All right, we're going to go prescriptions real quick. Everyone, it's pretty well known that there are prescription lists that usually they try to get going from a brand to a generic. That usually saves us and everyone money. Here is on your third page, going back to the beginning. Going to a formulary 2. What does that mean? And that was acquired. I got 1,500. How is going to a formulary 2 going to affect us? There's no changes in co-pays, but there is changes and there is removals in these tiers and formularies. Usually if they're removed, they don't come back. But there's also alternative medication. So with the recent changes on page, or with the changes, and 70 members are going to be affected. You see, here is the drug name in your first column. Here's your drug group. This is page 3. And 70 members, and this is the numbers of members affected. By this change to formulary 2, we have 70 members affected. Jardiance and the Viagra, 2 being removed, most affected script. So we've asked all employees to go through this list of medication. A new list will also come out January of 2019, which most of the doctors know what medications are that list well before we do. And start talking to your doctor about the alternative medication.
so this
Hey.
is the only medications here that will be affected.
They'll be removed from the list, and they're saying, here is your formulary option on the next few pages. And then there'll be a new list January of 2019.
And
So
Joe,
each January.
if the particular drug that you're taking that's being removed from the formulary is deemed medically necessary, you can appeal it, and if the doctor can
Well,
convince Care First that, no, this patient cannot tolerate the substitute drug.
Which is,
You need to get the drug. I mean, I've done that in the past with Care First.
well, I remember the night we had the hearing at the Civic Center with the retirees.
Yeah.
I mean, you made the comment that if there was a donut hole that people fell into, the county would subsidize that.
Well, this really isn't donut hole.
Uh,
Yeah, this isn't really
Yeah,
donut
but
hole.
if there's a drug that people cannot afford, the county could subsidize it.
Well, that's United Healthcare. That's a completely different plan. Donut hole, if we had an interest, the issue we found with the donut hole is that the types of drugs that were being requested were very, very, very expensive. And Michele, if I'm not mistaken, it was only 4 or 5.
it was one, two
Retirees.
people.
I thought it was maybe 4 or 5.
I'm sure they thought
And
they
then-
were very important.
Yeah, and then those that have,
Hey, I get that.
actually, anybody that's had that problem, that came in, we've been able to point them to another pharmacy that didn't have that problem. It's a very interesting process, and they're like, oh, if I went to Walmart, I didn't have to pay this much. So it's very personalized, and we are, we try to help them where we can.
Or, not online, but mail order prescriptions, are they cheaper?
Yeah.
And are you gonna educate us on that? There's a lot of people that I'm familiar with that don't know about the,
We try to I know we've told them over and over, we do educate people that mail order is cheaper, and I don't know if you want to cover it, and maybe it'd be
Yeah.
clearer,
We can certainly
but
do another internal, we
Yeah.
can work with Michele and do another internal campaign to encourage people.
I think their
That mail
frustration is
order
the setup
is-
process.
is-
I think
yeah.
that'd be good.
Actually, I just did it. It was not bad. It really wasn't.
Once they get
Just-
on it, they love it,
just
but
did
this
it.
is like getting
Yeah.
set up, seems to be.
Just did it.
Yeah.
And it's not uncommon in the county here as the broader audience, there's typically a low adoption rate for mail order.
Yeah.
For whatever reason, I think people just like the comfort of
Touching
going and
remote.
having that in hand and not worrying if, it's gonna arrive on time and things like that.
But once they get on it, I hear
Yeah,
they love it.
yeah.
It's like, oh.
Especially for maintenance medications,
Yeah.
Not for
your
the
90 days
pharmacies
supplies.
that you're showing.
Yeah.
Yes.
Those are the mail.
Yes.
See, on maintenance medication, they can actually opt for automatic refill so that they don't run out.
and maintenance medication would be something like antihypertensives.
Correct.
Yeah. Things
High
like
blood pressure, high
blood pressure
cholesterol.
medication, NSAIDs, things like the cholesterol medication. They send it to you automatically. It's a 90-day supply, isn't it?
Correct.
Yeah.
9
Correct.
days cheaper.
Yeah. Any additional questions?
Well, I've experienced it all, so. And it seems to work.
Are there other questions or areas with respect to HR that you'd like to go into?
Just on this last one, so I would guess that we'd be staying in the EPO from here on out.
I would see no reason to change, John, to be honest with you, unless some better product comes out. But, yeah, I think it's a good move on the county's part.
And we tell the employees, if you're uncomfortable to change, we also have FSA. Put your money, put your savings into FSA, try it for a
Right.
year, try it, and then at the end of the year, that's a
Right.
use or lose. You may, a flexible savings account.
Flexible savings.
Do
Put
we
it
do
in
that in
FS
the county?
Yeah, oh yeah, absolutely, put it in your flexible spending, and
Yeah,
then.
but if you don't spend it, you lose it.
Well, they have, plan. Yeah, and
Yeah.
I
That's
always
the plan.
joke, because I use FSA for my children's braces, and and one year I had money left over. You can go out and buy prescription sunglasses, use up that money, and that's what I did.
Well, they used to
Yeah.
allow you to buy over-the-counter medications. Do
And
they
you can
still?
do it on some FSA.com store,
Yeah.
So-
Yeah.
so you're still able to do that and do it over online.
As long as
Some
it's
people don't
IRS
know that.
compliant.
Yeah.
A question
I'm learning a lot out there too.
A question came up yesterday, this isn't related to any of this, but a question came up yesterday about the state's attorney's salary. And I know there's confusion about that, and I thought if you could walk council through where we are with state's attorney salary. There's the legislature passed a progressive increase.
Phase in.
a phase-in, and
Well, the
I
only
can't
reason-
explain
The
it.
only reason the
Michele
question
could
came up, Wayne,
Yeah.
it's rather simple.
The
because-
footnote.
The footnote.
The footnote.
And I was wondering that if the
Yeah.
footnote was an increase effective July 1st.
I think it's
What?
January 1st. I think the increase is
I
January.
think that was up in the air, whether it was
January 1st, 2020?
No, it's phasing it. There's increases each January following through 2000, or each July through 2020. They're
Well,
phasing
what
in.
was budgeted was a certain amount, and yet the footnote was higher, was about, I don't know, $4,000 higher.
Yeah, when we
So I was
turned,
wondering why that wasn't just in the budget.
when we turned the budget in, the legislature was still in session, and this whole issue was still up in the air. But I can't, Michelle's the person who can tell you if
I know
if-
what's
if we've
actually
got a
in
good
Munis is
number.
actually what I work with. I actually work with Paul in interpreting the legislation on
Okay.
whether it should be July or January when it was, the question was, and it's a difference between interpretations, from our current attorney to prior attorneys on
Right.
whether the state's attorney receives a pay increase and during when they're sworn in,
Right,
first of the year versus July each year as part of the phase-in, and there's two different interpretations of that. And so I think that I adjusted the final number to the final interpretation, in which I have in writing, that they do phase in, and every July they get the raise, versus the prior interpretation, that would be your difference in footnotes. And I have
So-
both emails to support
so the
that.
number,
Yeah, it's
so the number that's
interpretation.
in the budget is the correct number, so that if council
Yes.
approves
Based
the
on
budget,
current
we've got
interpretation.
sufficient funds. Okay,
Based on the current interpretation of the law.
understood. Okay, it was confusing.
The only other thing, very kind of petty, is that, because we just look at what's there, and the office expenses had increased. We're only talking, if office expenses about 9,000, which were about 6,000 2 years ago. I was just wondering why office expenses. had
There was
increased.
two accounts 2 years ago. There was a Munis payroll account that we only bought check stock out of, and there was just an office supply account because we were implementing Munis. So that's the merger of two accounts. And because it wasn't being charged, okay, you're only buying payroll stuff versus you're only buying HR stuff. Now it's kind of like we're buying paper, toner, everything out of one account.
Okay.
And you'll
So
see
that
that
was it.
old account, it should be zeroed out, office supplies Munis.
Okay, that's where the difference.
Yep, that's
comes in.
where we just merge them together.
Great. Go ahead, Jim.
If an employee changes to the EPO and through some snafu, it's not working for them, can they flip back over to the PPO?
Sure can. Oh, during open enrollment.
But
Only during
Yeah,
open
Or
enrollment.
unless you have a life change, then at that point.
Is
you
that
can
once a
change.
year or twice a year?
Once a year,
So they'd have to wait a year?
yes, unless they have a life change, and then they can change then.
So if you
Get
have a-
married, have
How about a
children.
diagnosis?
No, that's not,
That doesn't
no.
qualify?
No.
Okay.
Have
So
children,
they're, so
something.
they're out of luck for a year if it doesn't.
Yeah, that's why I said, if you're uncomfortable, go do, like, I tell employees, go do your homework, go check, go look at your history, go look at the doctors, find out, chances are you're gonna find out you are in network. And then if you're uncomfortable with the change, put the money in your FSA account. And then at the end of the year, if you haven't used it, then find something else, you can spend it on so you don't lose it. But that kind of puts comfort in there, in that change. So it's not like, and that's pre-tax. What is it, $26.50 a year? You put in there.
Any other questions?
Anything else?
I have
Right.
one question to
Yes,
follow
yeah,
up on
sure.
Joe's. If an employee does decide to stay on the PPO, just for clarification, the employee is responsible for their premium share as well as now they would have to pay what the county had originally paid on their behalf?
The difference. We are supplementing everything by
The
the
difference
EPO,
between the
same split.
EPO and the PPO?
Yes. We're
Correct.
still supplementing that contract with the EPO difference.
Okay.
Or, yeah, split.
Okay. All right.
Thank you.
Thank you very much.
Thank you, ladies.
Bye, Jane. Okay, we will reconvene. The next item on the agenda for the May 22nd, 2018 Wicomico County Work Session is the Sheriff's Office. Good morning.
Good morning.
Sheriff, how are you?
How are you, sir?
Fine, good to see you.
Mike?
Good to be seen. Hey, Larry, how are you?
If you could each just state for the recording your names and your positions, that would be helpful. Thank you.
Mike Lewis, Sheriff, Wicomico County. Seated to my immediate left, your right, Captain Todd Richardson, Wicomico County Sheriff's Office. Seated to my right, your left, will be Julie Struckbond, our financial assistant and specialist.
The one that knows everything.
Absolutely.
Yeah, specialist. Captain, you usually take the lead on this, don't you?
Generally, yes, sir. I basically have a,
No offense. Sure.
Mike, you got demoted.
I know how you like to delegate.
Absolutely.
That's your strong suit.
well, I'm going to start with just a, more or less a prepared statement that we provided. The Wicomico County Sheriff's Office submitted its budget with hopes of increasing its sworn deputy roster to include 4 new positions to assist with manpower shortages at our circuit and district court buildings, as well as within the Wicomico County School District. Adding these positions would potentially alleviate overtime expense overages to the current budget. To assist with the increased costs of the salary budget due to the number of sworn positions and mandated FOP increases, the Wicomico County Sheriff's Office reduced its overall capital expenditure request by $167,000 from the previous year. While our fleet is well aged with high mileage and increased maintenance and repair costs, we also need the additional manpower and decided to request only enough vehicles to equip them with minimal emergency equipment to replace those primarily used by the school resource officers. The vehicles that are currently used by the school resource officers would then be dropped down to our courts division, and then we would of course get rid of the highest mileage vehicles. Currently, we have 12 vehicles that are still 2005s in our fleet, and another 4 2006s. So we would be able to alleviate 8 of those vehicles to try to get some of those vehicles are well in excess of 200,000 miles. That was our master plan as far as going into our budget presentation, our preparation. Our operating increased by about 3%. Those increases were primarily because of our building maintenance costs had been absorbed through Public Works prior and then brought into our budget. So therefore, that was part of the increase. And Julie, you could speak on the other part of the increase.
The other part was the bulletproof vests. We lost a lot of grant funding this previous fiscal year from the federal side.
How come?
It's just not available.
They
I believe we got like 34 cents from them.
Costs more than that to mail the check.
If you have any specific questions in reference to our operating, like I say, we were managed to keep it at about a 3% increase. The executive asked to stay 2 and under, and the only reason that we weren't able to stay with that primarily was the additional $25,000 in janitorial costs, which originally were not in our budget and now are.
Yes.
And this year, we are hoping to absorb that cost. It was put into our budget post the approval of the budget, so we tried to reduce spending in some of the other areas in order to be able to absorb that additional cost.
Questions?
How many cars have you getting over the last 2 years?
10, the 2 previous budgets years, 10 each of the last 2 budget years.
So that's 20?
Yes.
So how many you asking for now?
We're asking for 8. We also, in order to reduce the cost of these vehicles, we also are doing a pilot program of going with the V6 Charger, which is a less expensive vehicle. Also, because these vehicles are going to be used primarily to, well, 100% to replace vehicles in the school fleet. They won't need some of the additional equipment such as the radar units. We will still equip them with MDTs, obviously. We will be down with a small amount, and there's other pieces of equipment that we don't put in patrol vehicles. The in-car camera, we will not put in those. That's a huge cost, about $6,000. So we've reduced our vehicle costs from about $54,000 per road patrol unit to $38,000 for these vehicles. And like I say, we've also reduced the number of vehicles from 10. We request 15 every year. We've gotten 10. This year we requested 8, and 8 was approved through the executive's budget. Added, like I say, $167,000 less in capital, and that was in an attempt to absorb the cost of requesting 4 additional deputies. Only 2 deputies have made it to your desk, so.
You know, with the increase in school shootings across the country, in the last 10 school shootings alone, we've lost 128 children in this country. We can't help but think about these old, dilapidated 13-year-old cars with 200 and some thousand miles on them sitting in front of our schools, looking very shabby. Quite frankly, would not be able to respond across the county to other schools that are calling for assistance in the event we have an active shooter situation. These are 6-cylinder Dodge Chargers that we are requesting. They are $16,000 a piece cheaper than a regular patrol vehicle would be. And it's time that we present an image to our county that we are ready and able to defend our schools and to respond to other schools in the county for assistance. And that's exactly what our SROs do in the event there's any incident that requires mass arrest. And we've had several of those over the years. We've had a number of our deputies have to respond from other schools to a school where we have a situation that has to be dealt with rapidly. We think it's time that we've replaced these ragged out cars sitting in front of our schools throughout Wicomico County with a decent vehicle and use those vehicles to put down at our courthouse and rotate those high mileage vehicles out of our fleet. And this is a very inexpensive way to do it. We want to equip them with a fraction of the equipment that we would equip a patrol car with. As the captain already said, we're talking about obviously an in-car camera is a tremendous expense. And other things that we would equip a regular enhanced patrol vehicle with, we will not be able to equip these V6 Chargers with, but at least we'll have a decent vehicle to respond in the event something occurs here in the county or our schools.
When school's out, these vehicles will be used for regular road patrol, correct?
They're not only used for road patrol, but they're used for overtime assignments throughout the county. Parks and recs, movie theaters, athletic events at our schools. Could be a football game, baseball games, soccer events, weekend activities at our schools. These school resource deputies are always involved in those events as well. But they will be involved in all that. They won't be sitting.
So they won't be equipped as well as the other cars?
They will not.
Even
No,
though they
not
are.
for conducting routine traffic and responding to accidents, et cetera.
But for the 2 months that school's out, and basically that's what we're down to now is 2 full months of school being out. One of those weeks is going to be mandatory SRO training every year that they will all attend. We also encourage them to take their vacation and off time during the summertime as well, so that they basically live their life around the school year, so that they're present during that, so we're not backfilling them with road patrol units. So when we take that 2-month period that school was out, in actuality, it's quite a lot smaller than that because of all the other things that they're doing. We bring them in back a week early for training in the schools. They give tours to our other deputies of the schools during that week, so that when we're responding to schools, it's not the first time a deputy's walked into one of our newer schools. I know this year we're going to have another new school go online in September. to be honest, I walked into Bennett Middle the other day and did a tour of that for the first time, and I was quite surprised at the size of the place. It's a,
How about that hallway?
and I did it as a tactical commander, looking on, how I would deal with a situation there. So we try to, we use these school deputies during the summer for those type of events. We also use them to backfill in the court system so that those people can take vacations as well.
Did you say the cars were gonna be a piece?
Roughly 38,000.
38, and you asked for 10, but it was
No, we only ask for 8. Normally,
Previous years.
previous years, we've asked for 15, and it's been cut to 10.
Okay.
This year, we asked for 8,
Okay.
and 8 was put through to you.
By the county executive,
And-
because we were requesting additional positions for deputies,
Yeah.
manpower.
Our main reason for basically sucking it up on vehicles this year and trying to reduce our cost was to make funds available for additional staff. I realize additional staff is not a one-time expenditure, it's a long-time expenditure, but that's why we dropped our capital request by $167,000, trying to do our part in absorbing some of the additional costs of additional deputies.
Joe, and although the vehicles won't be equipped with in-car cameras, the school resource deputies will be equipped with body-worn cameras,
I'm sorry.
Go ahead.
which is considerably
These things are
cheaper.
gonna hold up?
I've done extensive research with other cities. Salisbury City uses V6. I attended the FBI National Academy big conference this year because it was in Washington. It was easy to attend. I spoke with every manufacturer there was, and no one's having problems with it. And quite honestly, they make a lot of horsepower with a V6 nowadays.
I just wondered about the
yeah.
mileage end of it. We've been
Well,
getting a couple 100,000 out of them.
Well, and that's the other side of it is our school resource deputies do not put the number of miles that a normal road patrol unit would do. And if these vehicles do well throughout the first 3 or 4 years and we don't have maintenance issues, well, for one, the first 3 years, they're going to be covered under warranty because they're not going to go over their number. When we put a vehicle on road patrol, generally, we only make it about 18 months before they're out of warranty for a road patrol vehicle. We think we'll get the full 3 years warranty, bumper to bumper, out of these vehicles, which again will help drop our maintenance costs, which is one of our highest percentage costs in our operating budget is our vehicle maintenance costs. Between vehicle maintenance and fuel, it represents a huge chunk of our operating.
Mark?
You mentioned body cameras. I mean, I know we've talked before. I'm a big fan of those. I think there's $66,000 in the budget for that. Does that include the capital cost and the operating and storage, or is that just buying the cameras? How much does it cost after you buy them to maintain, store, all that kind of stuff?
Currently, we're on a test program where they basically gave us the cameras in order to get our business, and we are paying for the storage. The system that we are hoping to enter in with, we would get replacement cameras every 2 years, and the primary cost of the whole system is the storage, not the hardware.
Without a doubt.
And because of the way technology works, everybody knows, a 2-year-old piece of technology is probably spent its career. So that's why we're trying to enter into a program where we would get new technology every 2 years, and the primary cost is storage, not hardware.
So that camera, it looks like you're on the last page looking for one camera. It's 66,700.
That's the camera. That is the body camera program. That's not
That's
just one
the
whole
camera.
program.
That's the whole program.
Whole program.
I thought that was a lot for one camera.
And we're huge, and we are huge proponents as well as the body-worn camera. We absolutely have experienced tremendous success with them thus far.
And
Outstanding.
Make somebody honest.
Absolutely.
not only does it make it easier on the agency, all our deputies are realizing that it is making it much easier on them, because these false complaints that come in, look at the video. Our deputy acted appropriately and you didn't, and that's why you're in your situation.
And I know there was part of the concern before about that is, if people wanted access to it, the time it would take to review, staff time and things like that. Have you had much of that? I mean, how has that worked? Has there been public requests and things like that?
If a FOIA request is made,
Yeah.
they can certainly get a copy of any video clip of the body-worn camera.
But do you have to spend much staff time reviewing it? I don't know if you've gotten anything like that yet and to experience like how much, time it takes to review or anything like that.
Actually, what we're paying for besides storage is the review system.
Okay.
And literally, if you give me a time of day and a deputy, I can be at that video within seconds on my computer.
Okay.
We have the ability to send it directly to the state's attorney. We actually have the ability to send it as a one-time view to a defense attorney via email. Those type of things are very easy through that system, and that's part of the system they're selling us with the software and the storage.
So there's not a lot.
It's
of
not been
it's
too
not a lot of
burdensome
staff.
thus
Okay.
far.
That's what
It's not been
that's
too
good.
burdensome.
And what sort of, does state law govern how that's released, or do you have internal policies? I know different places have different, but I didn't know if state law governed it or if there's something that you just do. So.
Right now, our current policy is that we don't release on FOIA until the
Case is adjudicated.
case is adjudicated. And that's,
We have a policy on that.
You have a policy?
Absolutely.
Yes.
We do have a policy in place, absolutely.
Okay, but that's not state law or anything like that. It's just
It
your,
is not.
your department policy. Okay.
and I guess it's worth mentioning that we waited probably 18 months to 2 years before we instituted our program with body-worn cameras, where other people were jumping on it almost immediately, and we had the ability of them working out most of the kinks for us.
Yeah.
There's software where on a FOIA request, if the issue was with, say, Councilman Cannon and everyone else was in view and they didn't want to be in view, getting you out of that view was difficult. Now with the new technology, you go in, they put a click that covers your face and it follows you throughout the video so that you're never exposed. And it's all software that was developed over the last 2 years, which,
Plus.
this came on, I guess, fairly suddenly with the body-worn cameras, and a lot of people jumped on it extremely fast, and we took our time a little bit, and we got the advantage of the advanced technology, and we're very happy with the system we're working with now.
Mark, there is
Yeah,
a
I appreciate
model
it.
policy on these, on the release of the footage of any in-car camera or body-worn camera footage. There's a model policy through the International Association of Chiefs of Police. We adopted that policy and personalized it to suit our needs and the needs of Wicomico County.
All right, well, I appreciate all the work you've done on that, because I know there's been
Thank you, sir.
concern about that, so I'm glad you jumped on it. Yeah.
How many school resource officers you got?
We have 10.
They're gonna increase next year? Is it gonna increase?
It went from 9
To 10 this year.
10 this year, and that was, I guess,
Yep.
the last 61 days of this school year. We produced an additional SRO. What we did is we backfilled through court security, and that way we had a consistent SRO at Pittsville every day. So we took a place where we didn't need someone that had to be the exact same person every day. We backfilled that on overtime that the Board of Ed is paying for. So we're billing the Board of Ed for that one extra person for that final 61 days. In next year's budget, it shows up as part of our revenue coming from the Board of Ed for the 281 days.
Okay. Two question?
Yeah, I don't know if you mentioned it. If you did, I missed it. The 4 positions requested, what would their primary assignment be?
There was 4 requested, but 2 granted, correct?
2 were granted, okay.
Yes.
What would their assignment be?
Patrol,
Patrol?
absolutely.
Do you have any vacancies right now? Unfilled deputy positions?
We do.
You do.
And obviously with the recent death of Deputy Steve Ray, that's going to be a vacancy,
Unfortunately.
a very difficult vacancy to fill, quite frankly.
We only have 1 vacancy that is other than that one, and we were hoping for the other 2 that would be approved. We are in the interview process and hope to have those people ready for the July class should they be approved through this budget.
Okay.
And we have a deputy currently in the academy who will graduate on June the 14th.
Do you have any that will possibly retire this year? which would create another vacancy?
Yeah, we have people in the drop program that are that could possibly retire tomorrow.
It's possible.
It's possible they could retire tomorrow, but our primary goal right now would be to get those deputies ready for the July class, because from the time the budget is struck and we know we have those slots to the time the academy starts is fairly short. So we start our process in hopes of getting what we've asked for, and if not, then they go on a waiting list, and should we have a retirement or whatever. The problem is the competition for qualified applicants is stiff, very stiff.
It sure is, but we have a quality gene pool this time that we're pleasantly surprised with. Considerably smaller number of applicants, but this group has been very sharp to process and work with. They're great on interviews, physical agility test, quality gene pool, no doubt about it.
How does, we're paying for them to go, right? To go
Yes, sir.
to Warwick. Is there any requirements that they work for us for a certain amount of time or have to pay back the schooling if they happen to work for you for 6 months and decide to go to another department?
SPD, all agencies have it's anywhere between 2 and 5 years.
So what do we have?
For Wicomico counties, 3?
It's 3 years.
3 years.
3 years, okay. So, and then if they leave, they have to.
Absolutely, they have to reimburse us.
There's certain things that we can get through reimbursement. Salary is not one of them. It's federal law that you can't get back the salary, equipment that we spent, that type of stuff, the cost of the academy, that type of thing. I've been through a couple of court battles in many years back trying to get back, and we lost all of them.
So you don't usually get it.
Well, once they've reduced what we asked for back in the contract, now it's under control. I know that. I know SPD had lost several
I've not
fairly
had that
quickly.
problem since I've been sheriff.
Correct.
The captain's going to say, I know we had an officer, SPD had an officer that left to come to our office, and he wrote them a check for $18,000 and some change when he left SPD very early on. I've been very lucky and blessed. In 11 and a half years, I've not had anybody where we've had to seek reimbursement at all.
The
It's been 11 and a half years.
the only question I had was, it's just more curiosity than it is worrying about the actual budget numbers themselves, but uniforms seems to go from around 14 to 7 and then back to 18. I'm just curious as to if that's a cycle that always occurs or what's
Well,
happening there. Just curiosity.
Depending on the job assignment, we buy quality uniforms. I'm not going to try to hide the fact that we buy expensive uniforms, but they last 4 years. As a matter of fact, the shirt and pants, I lost the weight, and these are about 9 years old that I went back in my closet and found. But they get torn, they get worn, and we don't want to present a bad appearance. So we put them on a replacement policy, but a lot of our uniform cost is the initial cost, because you have to buy a dress jacket, a rain jacket, a winter jacket, and a full set of uniforms. Also includes a vest. Vests are expensive. Vests are out every 5 years, and that was probably part of what you were seeing with the ebb and flow of vests.
Kind of develops a cycle.
It was with the cycle. Fortunately, a lot of that in the past had been taken care of by grants, and those grants are just starting to go away. And I asked about it, and the reason is that when vests became popular, the federal government wanted everyone to have them. They put this money out there between the federal and state government, and now they believe that it's been long enough that we should have figured out that how to pay for our own vests, and that's where it's going away. And of course, the cycle of grants, money goes from one area of importance to another, and everybody knows the importance of the grant monies right now is going to school security and the heroin epidemic, and that's where we're seeing all our grant monies go. We just saw that state highway went to basically nothing next year.
In light of what Michael touched on, in light of the recent deaths that you've seen so many over the last couple of years, I'm really surprised. Maybe the tide will turn, as you say, and next year they're going to change their priorities to look out for the law enforcement, who obviously is under huge threats compared to where we were 2 or 3 years ago. The 8 vehicles, I'm glad you got the 8 vehicles. I know that you had said a few years back that
Yes, sir.
about 12 a year is
12
what
a
you
year.
really needed to substantially pull the old units off the road. Is that still the same number, Michael? where
It
you're looking at
certainly
12?
is.
Uh-huh.
We could use 12 a year every year easily, or 15. But 12 a year to try to get us back where we need to be and to get rid of this aging fleet. We have 5 vehicles in excess of 200,000 miles, 230, 240,000 miles on them. And very unsafe to travel anywhere, let alone at emergency speeds responding to a call.
I see them sometimes.
Yeah, we have some that,
You see them and you're going,
You're a little
"My
bit
God,
ashamed of
that's-"
them.
I don't know if they're still Crown Vics, or I don't even know anymore. I
Some
use
of our
Crown-
citizens actually take pictures of our old cars and send them to me and say, "Really?" with a question mark.
Yeah, I've seen them.
Yeah. It's embarrassing.
Yeah.
We do what we got to do.
Yeah.
But thank you all for your support on that. I really do appreciate that.
Yeah, we didn't like pulling them last year, Michael, but we had things we had to worry about at that
Do
time.
you get historic tags for the old?
I will tell you that we recently sold some vehicles at auction. One of the vehicles was on the road 2 weeks prior, and it brought $100 at the auction.
Scrap metal's no price right.
We were literally driving that vehicle as one of our functions, and it was due to...
Next day, you got $100 at the auction.
Yeah, we got $100 for it at the auction. So,
I got a deal.
We appreciate you all coming to take the
Thank you,
time.
John.
Yes,
Thank you.
All right.
I'd like to just say one last thing. I've been doing this for 5 years, and I've been doing it with Councilman Hall along. I know this is going to be the last budget presentation I do with Councilman Hall because he's not coming back. I'd like to just say thank you for all his support and guidance. We've had some off-bar conversations, and he's helped me a lot throughout the years, and I just want to acknowledge and say thank you.
Thank you, Captain.
Thank you, Captain. Thank you. Sheriff, Julie, appreciate you all taking the
Thank
time
you all
to
so
come in.
much.
All right, you have a good day.
Next. Thank you, sir. Appreciate it.
Thank you.
Your pleasure. We'll be in touch.
The next budget department is Public Works, and I thought I had seen some individuals from Public Works in the hall. Are they here?
Yeah, they're out in the hallway, Joe.
We can start early if they'd like.
Yeah, let me, I'll round them up for you. Anybody else here?
While we're waiting for them to come in, John, is this a good time to talk about perhaps some of the capital being funded rather than using PAYGO money?
Sure.
A suggestion has been made that some of the capital projects, that perhaps instead of using PAYGO funding for them, which is general fund money, that perhaps we could use borrow money to fund some of those projects, and then use the PAYGO money for the Board of Education projects. Does that?
In other words, if there's $1 million worth of funding going to a particular department for capital expenses, we pull that million and keep it and take it out of the PAYGO for that particular department, bond it, and use that PAYGO money for the Board of Education or any other expenses where we think we might want to increase their funding. It
It's
was
something
simply
to think
proposed.
about, yeah.
And the reason for that is,
If council wanted to give the Board of Education some one-time funding.
in anticipation that interest rates are going to go up pretty dramatically in the next couple of years, of course, or...
That I'd have to have
or the
Mr.
funding's
Strausburg
not-
talk about.
Will not be available in the future.
I think it was just an option they were trying to give us, John, to just simply say, if you're looking for funding from somewhere as opposed to cutting a department, you might transfer these monies into the bond.
Correct.
I'm a little concerned about it because I think our percentage of debt right now it's about 11.5%.
Right.
And if we were to move some monies around, that might
Wayne.
go up to the maximum of 12. I don't think we want to see that. And I also think we have a huge reserves. I think we have huge reserves that if we're looking for any money,
Huge,
it could probably come from
huge reserves means we have over a 9-month supply or a 9-month advance that we can pay generally, our commitments. And once you get over that 9-month period, then you have a huge reserve. And I think we're at that point, actually, where we can cover our responsibilities for 9 months.
Well, I mean, I know there's pressure from the state to always spend down our reserves for some reason. Yeah, I think we hear from the state sometimes we need to spend down our reserves. They kind of look at that and.
Want me to come up?
You could come up, Wayne. Yeah, it was sort of like an ad hoc, we had a little couple minutes, we wanted to just try to throw it in
And I
there.
guess my comment would be, the state likes to spend all the money they have plus some, it seems, and I kind of like the fact that we have a little bit in case we have a downturn to come
Yeah,
in
I
the
think
future.
when Mike Klegger was here, I think he indicated that the GFOA believes that 30% of your revenue, your recurring revenue, is a good threshold for your unassigned fund balance. One of the things that I would say, and we're clearly there, we're a little bit higher than that. One of the things I would say is that the state's distributions of income taxes lag by about 16 months. So in terms of what we anticipate receiving in the fiscal year, you've got to look back 16 months. We, as you know, have had a nice growth in our employment figures, but that growth has now leveled out. So think about 16 months out, what employment is going to look like and what income tax receipts are going to look like. So I'm a little reluctant to get very aggressive with spending down our reserves. Each year, we've budgeted about $10 million use in prior year revenue. We haven't had to use it because our income tax receipts have been climbing so rapidly. If we utilize that $10 million this year, if income tax receipts flatten out, we're going to go from about $40 million in unassigned reserves down to 30. And 30 is a threshold that I personally wouldn't want to see us go under. So if you were to ask me, my preference would be, let's continue with the anticipated use of $10 million in prior year revenue, but if you want to do the portables for pre-K through 12, for pre-K.
Pre-K.
I would rather borrow an additional $3 million for the airport projects and pay for the portables out of prior year revenue. In other words, just switch. At 3.5%, which is what I think our borrowing costs will probably be, we're going to sell early this year because we're going to sell before the midterm election because, I think that'll unsettle the markets, particularly if there's a change in House and or Senate leadership. That'll add about $210,000 a year in principal and interest. Still keeps us well below the 12%. So if you were to ask me, if we want to do this, what do you think is the best way to do it? I would say, I think that's the best way to do it.
One thing, John mentioned interest rates. There's one thing that dictates what our interest rates are.
Fund
A lot of
balance.
times, and that's our reserves.
Absolutely.
And
Absolutely.
we reduce our reserves, we most likely could raise interest rates.
Absolutely.
A strong reserve.
So there's always a balance that would
A
walk.
strong reserve really allows us to borrow, and that's one of the reasons we've been able to build the schools that we've built.
You're absolutely right.
And do borrow the money that we've built. So
But I think a 30 million is as strong as a 40 when it comes to the bond market.
Yeah, I would say that the markets would look at what your trajectory is, and if we were utilizing fund balance for good purposes, and I think we do, and they looked at our trajectory in terms of employment, property tax receipts, income tax receipts, and we were stable and growing somewhat, I don't think they would ding us on that, John. I think if we get below 30, I think that they would start to get a little nervous.
Mark?
If we were to do that, at the airport, like you talked about, that, we couldn't do that ourselves. That requires working with the executive's office, is that right?
We would have to, if we did that, we would have to amend the CIP.
Yeah, okay. Yeah, so
We would have to amend the CIP.
we all have to.
The
work
reason
together.
I originally proposed that we pay for the airport projects out of fund balance as opposed to borrowing is that we anticipated borrowing on the same timeline that we've normally borrowed on, which would mean that we would be funded in January, February of 19, and that would delay certain projects because we wouldn't have the cash in hand. But because we want to go to the market early, we would have the cash in hand for the airport projects, and it wouldn't delay any projects. So it's a timing difference.
To the plus
That's
side.
really yeah.
To the benefit.
Yeah, it wouldn't hold us up. So, I mean, I'm comfortable, if council wants to do that from a financial standpoint, I'm comfortable with it. Naturally, the executive has to agree to it because we have to amend the CIP and we have to amend our bond bill.
You were suggesting that to take from the reserves, there may be, it may create a problem in the fact that rates may go up, or actually more so, forget rates may go up, in the fact that you had suggested that income tax receipts may go down in the future.
I don't know that income tax receipts are going to go down. I don't really anticipate, but I think the acceleration or the trajectory of the rates, the income tax receipts is probably going to level out in the next 12 to 16 months because we're seeing employment leveling out. We've got that 16-month lag in
right.
receipts, so I'm thinking 14, 16 months out, we're probably going to see a leveling off of income tax receipts.
Could that same scenario create a challenge, whereas if they do level out and we have borrowed more, that in a sense then would increase our debt service obligation to the 12% or above, if you follow me?
Yeah.
Because the receipts are going down, but the borrowing did go up.
We would have to be, if we
Because
see.
we're close, we're really close.
If we see that trending, what we need to do is then get very, very careful with our CIP. And I think we have been careful with our CIP. What I always am very cautious about is committing to recurring spending, because that's where you can really get caught, where you've committed to this expenditure is going to reoccur every year, and now your receipts level out or go down. I get very, very concerned about us getting out ahead of ourselves. I think we've got headroom right now, but I think that we need to be, somewhat cautious with recurring.
When the recession
Yeah.
hit, the warnings had been there. In the papers and in the media. But unfortunately, it seems like the Eastern Shore always lags a little behind,
It does.
and
It does.
whether it's going up or going down. And those warnings, I don't think were taken. When that
does.
happened, that put us in a pretty perilous
Yeah, I'm
position.
keeping a very close eye on the employment figures because, that's a good barometer of what your trajectory is. And again, that's where the majority of the growth in our recurring revenue has come from over the past several years. So,
Well, that's what,
Yeah.
you're talking about recurring spending too, and that's what really concerns me. And I said this before about maintenance of effort. I think the only fault in that entire formula, I'm an advocate of education and maintenance of effort, but I think the only fault in that formula is that it obligates any county that wishes to maybe make additional contributions to also, be locked in to recurring expenses in perpetuity. It's not like you can be, unless, and you know how it is, we do the one time only. To try to be generous, because the maintenance of effort locks you in. It might be that a county wants to give $1 million more to education for 4 years, or something to that effect. Talbot County is doing some increases. I'm concerned that may come back in their 5th and 6th year.
it's also the
That's a problem.
five-year moving average because you're not only locked into what you have been spending, but you're locked into matching that 5-year moving average per pupil. So as that spending, particularly in the wealthier counties, continues to increase per pupil, if our enrollment goes up, and if our enrollment is coming from a demographic that is not a net contributor to receipts, you find yourself in a real crossfire. And I agree with you. I think the maintenance of effort construct needs to have a bit more flexibility in it that better addresses local conditions. But that's
what we
beyond
have
my
right now.
pay grade.
That's what we have right now.
Thank you.
Thanks for the discussion.
Mr. President?
Yes.
And speaking of universal pre-K, Wayne, so would you expect the maintenance of effort to go up since our enrollment will go up if the county decides to move forward with that?
Universal pre-K, pre-K doesn't roll into your full-time equivalent students
Okay.
right now. I think when you look, if you try to read the tea leaves, if you look at the governor and the legislature moving towards state-funded universal pre-K, I think that will probably generate in a future session incorporation of universal pre-K students in the FTE calculations.
I thought the Board of Ed said they had 68 additional students simply from pre-K and a reduction of 4 students in general population, which meant a net of 64 increase, specifically because of pre-K.
Yeah, I'll
Universal.
Yeah, I'll double check that. I
No.
didn't think that, I thought that MOE was calculated on K through 12. I didn't think it
I
incorporated.
think if they go all day, it
If they
counts.
go all day, it
Yeah.
does, you're right.
And the universals
You're
all
right. And the
day.
universal pre-K would.
So to answer your question,
Yes.
yeah.
So again, what we have to do, I think, as a county, is look at, okay, what does that population look like? And how many students do we believe are going to be coming through pre-K? And forecast that over, say, the next 5 years, because that's necessarily going to be a recurring expenditure. So to get comfortable with buying the 2 portables and funding the fixed costs for startup, I think we necessarily have to look at, okay, what does the 5-year recurring cost look like?
Which sort of kind of like, I guess, eliminates what my concern was about having the recurring expense, because it's not as if we're just giving, we would be giving extra funding for anything in particular. The fact that if we commit to this additional expense for pre-K, that's going to be a recurring expense
Yeah,
anyway.
you don't start
Whether
with
maintenance
stuff.
of effort requires it or not,
Correct.
yeah.
You don't start at the start.
So that's sort of a wash. That's if it's out there, it's
Yeah.
out there. Okay.
Okay,
Thanks.
thanks.
Thank you.
We do have to change the tape.
Okay. Okay, the next item on the May 22nd, 2018 Wicomico County Budget Open Work Session is Public Works, and I know we have a lot of people here today. Good to see y'all.
Want to start with our roads or solid waste?
I'll leave that up to you, whatever you want to do, guys. If someone has to be somewhere,
Let's start with solid waste.
okay, all right. I'm surprised roads even showed up. I figure they have a week off. Or we're probably still making repairs, right, Luke?
A little bit of everything.
Yeah.
So it's not just public works.
We'll let you lead, gentlemen.
What are we doing first?
Solid waste.
What number is that? I just,
Public Works is 24.
no, I got that.
51.
51. I didn't look at the other ones last time.
Just, if you could just give us an overview of where you are, what major changes you've seen this year, and
Yeah, so what we're looking at this year is not too different than what you've seen in previous years. We're looking at doing an update to the scale house. We're looking at continuing on with updating the dock replacements at the various convenience centers throughout the county. We're replacing some equipment that gets banged up as it goes along the roll-off bins and things like that for the recycling. 2 new pieces of equipment, which include a new track loader and a new roll-off truck at the landfill. And that's about it in a nutshell as far as asking for anything big.
Yeah, and that's just still part of the 5-year replacement plan that we showed before.
Can you talk into the mics? We're having a hard time hearing.
The scale house now is running about 20 years old, and it just needs to be replaced. It's just wore out. The state comes in, they've condemned 1 or 2 of them at a time, for different issues where we'd have to get them fixed. So it's just wear and tear.
Marc?
I see that you have recycling expenses at $70,000. Is it, what revenue offsets that? I mean, are we in the hole, or are we making money off recycling?
Personally, I think the best you can do is break even on recycling.
Okay. Are we doing that?
Yeah. Well, we're close. It's a little give and take sometimes. It's all market driven. It's whatever the bid prices are, whatever the markets are doing. Sometimes we do a little better, sometimes we do a little worse.
All right. I mean, and I also know you have state mandates. You have to comply with things like that. But,
And I'm sure your metal bins at the transfer stations fill up now quicker because metal's no price.
Yes,
People
they
are
do.
taking it to the scrapyard.
They do.
And, you might get more metal, but you're not getting anything that's
We're
worth
not getting
anything.
any more money for it, yes.
So, it's,
questions?
I do have a question about electronic equipment.
Yes.
And how has that moved since I assume there's still no market for electronic?
There is no market for that. Right now, it's going into landfill. It's not mandated that we had to separate it. It was proposed that was a wish from MDE that we do that. The cost all came back to us, and it was a hole that we just kept dumping money in.
We were spending money to have an outside contractor
Right,
come in
right.
and take that equipment away from us.
Oh, okay,
There was no real
Okay.
profit to it at all.
right. I know we were shipping it to New Jersey or something along that line.
Yeah. And then there's the whole thing of the people who we send it to. They have to be qualified. We have to get a letter of assurance back from them that they're doing the right things, because, a lot of people, they'll send it to India or somewhere like that, and
Okay.
it's all torn apart, so.
Okay, good.
You have questions? No? We're good there.
Good.
Thank you.
Mr. Allen?
Lee, last time I saw you, you were waist deep in water. How's everything settling down?
It's actually at a miss. It's a little better than expected. I can't speak for individual property losses, but as far as the roads go, we're in pretty good shape. I mean, we have some work to do, but nothing catastrophic at the moment.
Are we doing roads now?
Did the road hold up there where you had the equipment? It all held up?
Yep, we actually removed the stone off the road yesterday. There was still a little bit of water on the road. We kept it closed because we want to do an inspection of the road today in the bank to make sure that everything is okay and suitable for traffic before we turn it loose.
Okay. All right. Gentlemen, if you like to let us know exactly what's new this year and
Okay.
what you're anticipating?
Yeah, so, again, we'll head right to the capital expenditures. We're asking to replace a 1999 Gradall. You may recall we replaced one in last year's budget. This will be the second one we replaced with some age on it. We're looking to replace a front-end loader that's from 2006. And in our continuing replacement of mowers, it's a right-hand and rear mower. And we try to replace these one every 7 years. So basically, it's a repeated cost you see on the budget. The mower decks themselves get beat up over the time. We're not talking about replacing the tractor. These are just the decks. We're also looking to replace a tandem dump truck from 1996. Moving on from equipment, on the building improvements, we have a parking lot restoration project. This was in a previous year, I believe, but got cut. If you've driven out to the roads parking lot, especially in the back, you'll see it's severely chipped and alligatored, and at this point, if we ran the street sweeper through it, we'd probably tear a hole through the asphalt. I mean, it's in horrible shape. I would argue the roads parking lot is probably the worst road we have in the county, ironically. We also need to replace some of the concrete around the dock base where the vehicle comes in. That takes a beating. We've got some ADA ramps just to make the building ADA compliant with our sidewalk improvements.
If we go back, hold on to the parking lot restoration, $220,000 for parking lot? Is that, I mean, what size, I mean, I've been out there, but I mean,
It's a big parking lot. I mean, the back behind, I mean, what you see from out front is probably a quarter of what's out back. So you have the whole area in between the shop itself and the equipment shed. I mean, it's a pretty large area.
And with the amount of vehicles and the heavy duty nature of that equipment, it's not like we're going in and just milling out. You know, if we were doing a road, maybe we might mill out the top 2 inches and then repave that. We're talking a full depth replacement here just because of the condition it's gone into and the amount of structural support we need in that asphalt section because of trucks loaded with stone, trucks loaded with salt, dozers, Gradalls running over it constantly.
What's there now is what was put there in 1983 when it was built.
I guess, I don't doubt that it needs replacement. I guess I haven't seen it. I mean, you're out there a lot more than I am.
Please come out and look.
So, yeah, I mean, I'll swing by, but, that's 220,000. It's just, that's a big chunk of change.
Oh, yeah. I agree.
And looking at all the needs around the county in terms of, drainage and road repair and ditches and things like that. Wayne, what would be good to, serve the people of Wicomico County, but also, but then, I know this, helps make you guys more effective too. So, I mean, trying to weigh this stuff out is, that jumped out at me. I'm like, if there's $220,000 to, help with the ditches or, hire a crew for a year to do something, with drainage and stuff like that, that would be great to do. Although I do see why you'd want a new parking lot. So,
This is more than just aesthetics or rideability. If the parking lot continues the way it does over the next year, we're going to have trouble getting some vehicles in and out. Remember, this is also the facility that serves the entire county fleet for gas, that they come in to get their vehicles maintained. The sheriff's office comes in to get their Ames unit to get the equipment installed in their vehicles. The council brings their car in for oil changes. All of those vehicles come into the roads facility. And if the continues to deteriorate, you're going to see potholes that would not have vehicles be able to pass over them. I mean, it's gotten to the point where this is probably the last year that parking lot can function as a parking lot. Beyond that, again, please come over and take a look. I mean, when you can have a street sweeper drive over a parking lot and take up chunks of asphalt the size of your fist, that just does not function as a working surface for anything.
We're going to end up with someone breaking their ankle is what we're going to end up with. We constantly patch these humongous craters out back, And, because of the condition of it, they grow, it goes away. The trucks that go up to the shop to get worked on, it's just a constant thing of trying to patch all these holes that end up in it. So it's not an aesthetic thing. I don't, doesn't bother me if it doesn't look good, but it certainly isn't safe for people walking on it. I'd say that.
Yeah, I mean, we're seeing the cracks with the water getting in the freeze-thaw. And remember, we also take a lot more abuse on that parking lot because of the salt on the asphalt. It sees a higher concentration of salt than any other road in the county.
Fair enough.
Has Taylor Road been fixed yet?
Yes.
I know it has. When was that fixed?
It was paved about a week and a half ago, I would
Okay,
say.
good, because residents were contacting me when they had flooding, and I'm just wondering.
Yeah. Yeah, we,
Managed this week.
we actually raised the road about 1.5 feet and got it stabilized right just prior to paving. We still have some shoulder work to do after they've paved, but
So it's been raised 1.5 feet.
mhm.
Hope that helps.
Yeah, I mean, they're not gonna have a puddle now, so.
Good.
A couple of weeks ago, Dallas, you were in, we were talking about staffing. You said, it would be advantageous if you had, more people working as far as help cleaning the ditches. Have you got any plans for that in your budget?
We had put in a request for additional personnel, and I have not seen if that came through.
Got two?
Two in there?
Yeah, that's what I thought, yeah.
Okay.
I looked through this, I didn't see anything in here as far as revenues. Do you have a revenue stream? Revenues, I didn't see it.
It's not a lot,
Yeah.
other than the HUR and like some of our permitting fees
Yeah,
and stuff.
yeah.
But
What about,
Yeah, I mean,
you ride by the airport and I'll see county roads trucks out there, and I know you all go to the Civic Center and put dirt in the Civic Center. Does the airport reimburse you or the Civic Center reimburse you for that work that's done?
We get reimbursed from enterprise funds for equipment or materials used, and I also believe labor as well. Is that correct? Labor. So.
From both the airport and the
Yeah.
Civic Center?
Yeah, now if we do work for another department and it's a general fund, then we only charge for the materials that's used, but not the labor.
But to go off Joe's comment, I think you're probably coming to that. I noticed in the budget there was, speaking of the airport signage under your budget for $20,000. Why are you guys buying signs for the airport?
We were told they had a signage project, and we do have the sign shop within.
signs.
The road signs, so the roads on the road for the airport?
The directional signs to the airport,
Okay.
on Route 50, on Snow Hill Road. So
Okay.
any road signs
Okay.
And
come out of the road budget.
the state funds some of those signs, but won't fund them on the county roads.
Okay, gotcha.
Yeah, I had the same question.
All right, well, because Joe mentioned, he sees you. Joe lives down by the airport, I don't. So Joe may see you at the airport. Do you do, a lot of work at the airport? What?
It depends. We'll get calls for some of our equipment, like the boom axe or some of our larger mowers, out to help them out. We've been asked to assist with technical advice on their parking lot restoration. I know the Piedmont parking lot was pretty banged up. They were curious if it was something that could get just overlaid, would it need to be milled out. They had some questions about damaged curbing, the work that would need to be done there. We've done signage and thermoplastic line striping around the terminal. They wanted to highlight the crosswalks more, so we've done work for them out there as well. I think we also met them out there for the rental car parking lot.
we did some stuff out there. We did some work around their fence lines with some, where they had some openings underneath and took material in there and did that work.
Yeah, I think, and that was related to their FAA inspection. They had to, I guess there were places where someone could scoot under the fence, so we had to help secure that up so that those openings weren't there. Yeah, a lot of times we'll go out there just to kind of help them with some guidance. They've approached us for tree trimming. There are some taller trees in their flight path. We have a tree trimming contract, so we just kind of pointed them to that contractor and said, hey, just meet them on site and tell them what trees you need down.
So we're getting, the roads is getting reimbursed for all this work? I mean,
Some of the work, so in the case of the tree trimmer, it was our intention that, look, we've got a contract in place. The airport can just pay that contractor directly. It's not like roads pays the tree trimmer, and then we get reimbursed. It's just let them use all of our contract. In cases where we have gone out with our hot box and patched potholes, we do get reimbursed for that.
You said you do get, or you don't?
We do.
You do?
Yes.
What about when you just have personnel out there, doing some of the work?
Well, I mean, it's enterprise fund, so we would get reimbursed for labor and materials.
So the airport is an enterprise fund?
Yes.
All right. We hear different things on that sometimes. So, but when the personnel is out at the airport, they're not on the road. I mean, you have X number of people working for you, so if they're out there, they're not.
Yes, and anytime we get a call from the airport, from Parks and Rec, from the Civic Center, Salvation Army, up at Eugene Jackson Park, anytime we're doing that, yes, that takes a crew away from Roads Division to help out another division or another department within the county. But ultimately, it's all county work, so.
yeah, it's all county work, it all needs to be done. I guess, with all the issues we're having with roads and drainage and stuff like that, I was just.
It can be challenging at
We
times.
talked
but-
yesterday about, they're changing up the munis, with the IT department, not the munis, but the IT department, and about, I guess you call it the transparency of budgeting, what each department's paying the other one to do, just to make sure that, so we know where the money's going, how it's being spent. Not questioning what you're doing. That's
Oh, no,
Yeah.
it's.
No, I mean, obviously, you do what the direction is and things like that, but, I do know I get a lot of calls about roads, and it's not a reflection. I mean, people just are concerned about roads and not necessarily about the airport or the civic center, so.
No, I understand. I mean, on any given day, I mean, if we've got a full crew and we've got about 60 people, we've got about 700 miles of road, you're going to take out a handful of those for the folks that are in the shops making the repairs. We have folks that are out either cutting grass, so you're losing some folks for that. We have masons on staff that are going out and working on curb and gutters and inlets, so you take some of those folks away. And by the end, you end up with maybe 15 or so people, would you say, Lee, that are actually out on roads
We have
crews?
25 people now that go out on the road. And, 10 years ago, we had, plus we also have office staff, but, 10 or 15 years ago, we had probably 70 people. So it's definitely a difference than it was 10 years ago.
We also, 10 years ago, we were HUR,
Right.
enterprise fund. We were a lot flusher with cash than we are.
A couple of years ago, you bought a paving machine, I
Correct.
believe.
We bought a chip box.
Are you still using it?
We used it a couple years. Last year, we didn't have time to use it. We'd like to use it this year. The way things have been going with the paving operations that we're doing and some of these storms we've had, we just haven't had. It takes us about 2 weeks to dedicate 15 head to go out there and do that. So, when that was purchased and we were told at that time, don't look for $500,000 in your budget for the foreseeable future, that was certainly the direction we needed to go. Of course, the last couple of years, we've had some money for paving and so forth. So between that and these storms we've had, kind of the direction of what we're doing is a little bit different. But, I like using the chip box. I think it's a good thing for us to do. Some in-house, it saves money for sure. It's just having the time to dedicate, 2 or 3 weeks to it.
Well, the response from the citizens on the quality that the county was doing was very positive also. And
Right.
I think it was an asset, and I'm sorry that you're not getting to utilize it as much as we thought that you were going
Well,
to
not,
get to utilize it.
not now. I mean, if again, at the time that was purchased, there was no money for any other type of paving. So if we were going to do any service treatment, we were going to have to do it, and that's what we were going to have to use to do it with.
Okay, thanks.
Larry?
You got uniforms in here for 20,000. Last year had 25,000. Is that going to be a reoccurring expense every year?
Yes.
20,000?
Yeah, I believe the total was about 18.5 or so. So from what we've seen after the first year.
Why was it 25 last year?
It was the first year. It was an estimate. The budget was put together, and we had estimated 25, and so we took a look. And a lot of the numbers that you'll see for the reoccurring expense, what we did was we went back and looked at our costs that we've actually spent over the last 4 years and took an average. So you might see some items go down, you might see some items going up. But what my goal was to accurately reflect what we've been paying based off of the average over the last several years, not just, let's just keep putting in the same amount every year because we asked for that same amount last year. So it was more of, let's see where we can't try to shrink things down based off of what we've actually been spending.
Who wears uniforms, guys? So you guys don't have uniforms on.
No, it's pretty much.
Especially like all of our field staff wears uniforms.
And
They're
the
rented
mechanics.
uniforms, so
Yes.
they're rented, so they are turned in every Monday, and they wash them. If there's something wrong with them, they fix them, and then it's basically a turnaround system, so that there's a set that they wear and a set that's being washed and repaired or replaced if they have to
So you
replace it.
contract out weekly cleaning?
Yeah, it's
It's all part of the same service.
Not you first or whatever?
yeah, I think that's what it is.
Uniforms, yeah.
I think so.
I know they do that.
Yeah.
Okay.
Now, one of the benefits to that also is that, with the guys who are on the road, OSHA regs say you've got to have that ANSI green with the retroreflective striping, first inspects them, and if that retroreflectivity degrades to the point where it's no longer retroreflective, they automatically replace those.
Yeah. The cost in renting them it ends up working out about the same as if we purchase them. The better part of it is, like he was saying, where if we buy them, and especially the guys who say are on the patching crew every day, that it doesn't take long before they're horrible looking, and you can't even hardly see the green on them, especially on the front. So with this, they'll replace it. So if they can't get it clean, they'll replace it. So.
Obviously drainage is kind of the big concern, especially after this past week. I appreciate you said you hired in the budget for 2 new people to focus on that, I think it was. Just throwing out a number, let's say you had like an extra $100,000, could you use that to supplement your, the work that you're doing? I mean, what can be done with resources you have? What resource, if you had more resources, what could be done? I mean.
One of the things, so again, going back to the presentation a couple weeks ago, seeing that the largest problems we're having is on private drainage with ditches being cleaned out, and the challenge of what do you do when a ditch just kind of meanders through some woods and you can't get a piece of equipment back there. There might be, in my head, the thought was, well, maybe the value is in getting another inmate crew, using some of that money to hire another correctional officer to supervise the inmate crews that are out there, because in that case you're paying for one person but you're getting 5 or 6 actual workers. Now, the challenge on the other side for the correctional department is having inmates available to do that work, and so that's a discussion that we're having with departments of corrections and with ECI, and trying to figure out, okay, how do we get more folks? Because again, where we used to get a dozen and now we're getting 4. I don't know if the criteria has changed, if they're not seeing the number of people eligible, or if once they're on lockdown for one thing, if everybody has to stay away. But yeah. Sure.
We're having corrections come in next, so we'll ask them. How about that?
Okay, yeah, it would certainly be beneficial to have more inmates available. And again, like I said, if we hired an additional correctional officer, like you're saying, if you gave us $100,000, that's kind of where my first thought would be, because again, the equipment we have doesn't necessarily get into the places where we're having some of the problems at. So.
Yeah, I mean, I see the issue with the stormwater management at a real critical level here. I think that is obviously from the meetings that you held, and that's a huge high priority.
And one of the primary tools that we have for cleaning out these ditches is the grade all, which is again why we're looking to replace that. And again, the tandem dump truck, because remember, when we scoop that material out, we can't just leave it there. We have to have another truck to dump that into to haul off site. That's just state regs. So, I mean, there is equipment in here to help maintain our ditch networks.
Sort of remind me of what Mark said. I mean, do you have the manpower to cover this entire county with every area that you have to go to find out where the problems are even starting?
I heard a really wise quote that said, if you're happy with the level of work you're getting out of us right now, then we're good with what we've got. If you'd like more work, then
There are constituents who aren't real happy about what's going on. I mean, you're doing great work. There are a lot of constituents that think that we're behind, and we are. We're miles behind. But what agency was it that used to do this? The conservation?
Soil
conservation.
Tax ditches. and
Yeah,
they
I
get
think
out
when
of the
soil
business.
conservation kind of like dropped the ball, I don't think anybody ever picked it up.
Yeah, they contracted out, and some of the same players that were doing the ditch cleaning for them are still doing it, but kind of for their own business. So they're the same people still doing it, it's just not soil conservation, it's all contracted. So there's managers for the PDA that get these things done through different contractors.
Yeah, I drove by a guy during the storm over the weekend. He was walking down the road, he had a shovel, and he had a hoe, and he was going down 3 neighbors down to clean out the ditch. He goes, and I pulled over, and he goes, look at my yard, it's perfect, look at my ditch, but that one isn't. And he was going all the way down to take care of, the property of 3 houses down to address that.
How many grade offs do you guys have?
right now we have 4.
Yeah, we have, one of them kind of made on, so we have 55, 73, and 43, and then that small one's gonna be gone, so, 2 are, one's the new grade off, one's kind of new, but then.
Lee,
there's
grab
the
that
other
mic, it's hard to hear you.
I'm sorry.
okay.
We have, one's actually getting sold, we're gonna end up with, we'll have 3, that's it, at this point. And then, of course, if we get a new one, we'll be getting rid of an old one, so we're not gonna gain one.
How about road graders, motor?
We have 2 graders.
How about operators?
Yeah.
We have 5 people that can operate grade alls at the roads division.
Graders, road graders, you have people that can.
Yeah, we have people that can operate the graders.
We have some leftover money in this year's budget that we're looking to purchase a mini excavator with also to help try to get into some of these tighter areas. We're looking around to get quotes. We're arm's length away from June, but that's our goal is to get, use some of that leftover money to purchase the mini excavator that can get into some of these spots that the grade alls can't. But again, it's a scoop at a time, taking it out back to where the truck is because we can't leave it on site.
Well, I mean, I hope you don't take any of this as a criticism of the work you're doing. I think we all think you're doing, as good as you can with what you have. And I mean, I know the employees are doing what they can, and we appreciate that, especially after, a challenging week. I mean, last week, John and I were driving around, and, the fact when Pratt Road is the only road that some people have to get out, because Upper Ferry Road shut down and Pemberton Drive shut down, that's, Pratt Road's, the one that's usually flooded, so that, there's obviously some issues. So, I mean, and I think we're gonna have further meetings about, trying to address drainage problems. So I guess on our end, it's also incumbent that we make sure you have the resources that when we say, look, we'd like to be doing more as a county, we'd like you to do more, that you have the resources you need to say, all right, you want us to do more, you have to give us the resources. That's what we're
Let me
trying to
give you a
figure out.
quick for instance. I'm just going to give you,
Yeah.
just like what happened, this came up today.
Yeah.
So we're in the middle of dealing with all this stuff with the storm, okay? And we have a lot to do. We have problems everywhere. And at the same time, the business of life goes on outside of that. So we have a paving crew that's breathing down our neck that wants to get their job done. There's things that we're required to do in advance of them paving. And they decide that they're going to go over and pave this particular road tomorrow. Well, there's something that we need to do in advance of them doing it today. Well, so we have to stop what we're doing over here or figure out a reprioritization, and we say, okay, well, we can shuffle this around, and we can jump over here, and we can saw cut this road and scoop it out so they can pave it tomorrow, because we can't stop them, because we have a contract with them, and they have to be done by the June the 30th. So the business of life goes on outside of these storms, and we only have X amount of people, and we have X amount to do on a normal daily basis, and then you throw these storms into it, you know, it's shuffling the deck and reprioritizing all the time. So that's just a for instance of like today.
It seems like the biggest problem is you don't have the manpower. You seem like you got the equipment and stuff, you just don't have the manpower.
I think what Mark's trying to address isn't the quick fix that you're talking about. He's talking about something that's long-term.
Yeah.
Making sure you have the manpower for the long-term fix.
Yeah, I mean, because like you say, you know, there's your base, you know, whatever you call it, you know,
Right.
your base things, and then
Right.
all this stuff comes up, you have to deal with the emergencies, and it seems like the emergencies are getting
More frequent.
common. Yeah, so
More than normal.
So what, you know, what do we do to make sure that you can do what the citizens expect, which is deal with the roads and all the stuff you have to do year after year, and then deal with these emergencies that seem to be popping up, you know, every month it seems, you know, that there's something new where it's, you know, again, you're wading in water up to your waist, whereas maybe that was once or twice a year before, and now it's much more common. So, you know, just trying to get a handle around that, so.
Yeah, I agree with all that. However, Joe and I were talking yesterday, we had 13 inches of rain. And we talked a little bit earlier about recurring costs. So 13 inches of rain is like a 500-year storm. There wasn't any place on the East Coast that got that rainfall that didn't have flooding. Just like when you have a hurricane, you're going to have flooding that's unusual. So what we're trying to do is strike a balance between addressing those needs that we have so that we won't have flooding, say, during a 100-year storm. But again, for us to engineer, or I don't think there's any engineering that we can do in any level of manpower that is going to prevent certain areas from flooding during a 500-year storm, during 13 inches of rainfall. So that's really the balance that we're trying to strike here. And I understand the sensitivity to it. I certainly wouldn't want my lot flooding, my street flooding, but there's a balance that has to be struck.
And I understand, I mean, there's, you know, major events you can't plan for, but it seems that what used to be extraordinary events are becoming more common. So you know, so maybe that's more of, you know, it reminds me of the Board of Education, you know, that they don't build any snow days for the year. And we're like, it's obviously going to snow at least once or twice a year. Just build the snow. I mean, you know, it's this extraordinary event we can't plan for. It's like, well, we know this probably going to happen, you know, so it's the same sort of thing that this stuff is, you know, 10 years ago, this, you know, it was kind of a freak occurrence, and now it's, I guarantee you that, you know, this isn't the last time that, you know, of this year that Pemberton Drive or Pratt Road or Upper Ferry Road is probably going to be as flooded as it was. I mean, this is just May, so.
It's again the balance, and I agree with you. The weather patterns have clearly changed. We're getting more extraordinary rainfall, snowfall. So the balance for us to strike is, okay, to what bar, if you will, should we engineer the county? You know, is it a 100-year storm? Is it a 50-year storm? Is it a 200-year storm? And that's what we're trying to address here. And I don't have the answer because I'm not a meteorologist, but I don't think we want to try to engineer to a 500-year storm. So we're going to have flooding in certain areas.
And I think, you know, for us, we have to be fair too, because we're sitting here demanding, you know, swearing from our
Oh, I
people and
absolutely
demanding
agree.
you. So, you know,
I
it's like our,
absolutely understand.
let's say, you know, make sure that, that we have a responsibility to make sure they have the resources. That when
Absolutely
we come to
understand.
them to say we need this fixed, they say, well, you
I
guys
agree.
didn't provide us with what you need. So we're trying to get ahead of that.
I agree.
And the 500-year storms seem to be frequent. I think it's no different than what Ocean City sometimes had to prepare for. You know, they know that they have storms, but sooner or later they have to take a position. They say, it is recurring, it's a threat to the community, let's see if we can address it.
I don't know whether you saw the video of the White Marlin Mall.
No.
They had 5 inches of water on the entire parking lot. I mean, they had people out there in rubber rafts rowing around. So it's you know, it's just mind-boggling. And I was coming back from Baltimore because I'd been up on some personal issues. And as I drove back, I saw fields. I have a cousin who lives in St. Michael's. I saw flooding in areas where I've never seen flooding in my life along Route 50. So to your point, we do have to address it. My point is we've got to strike that balance between over-engineering and under-engineering. And we're under-engineered right now. There's no question of that.
Well, I think we made a good choice on picking where we wanted to do this study. And I think they will come to fruition, that will solve problems very, very soon. Because more recently here, it seemed like a lot of the issues from this most recent storm were in that exact same location. It didn't seem to just be as extreme over on Mount Herman or over at Kaywood as it was just in that one particular area.
And one of the things that we're doing too is, I showed that drainage map that we had where everyone had identified their hot spots. All of the phone calls, we're working with planning and zoning, all of the phone calls we received and the locations that we got are going to be added to these maps so that every time we're going to be getting more and more data points. We know where some of the big areas are out there on the Pratt Road, Nistdale corridor, out there on Cody Cox. So we know where some of our big points are. We do get frequent calls from folks saying, hey, when are you going to come fix this problem? When are you going to, everyone would like their problem fixed right now. We're certainly working on it. It's just, the tough answers are when you have someone they built their house in a bowl. There's really not a whole lot you can do. And those are the tougher answers when their backyard floods because it's low elevation. At what point you say, well, you built your house, or you built your house right next to a branch, and it's the floodplain of the branch.
And I accept that too. There's some cases where we have the water just pouring over the streets too. So
yes.
Can I change the subject a little? You had $200,000 on the Whitehaven Ferry, and it said it was part of a 3-year project. But it's not like anything in the CIP or anything. Usually, something like that.
I thought it was in the CIP.
It should be in the CIP. They're overhauled
couldn't
every
find
3
it in the
years.
CIP.
Both ferries, they should be on a 3-year cycle for overhaul.
Is that
Put
what
the
it
ferry
costs?
overhaul in the CIP.
You would not?
No, we don't.
Okay, because there were because I was looking, there were other expenses around that same price range that were in the CIP.
Ferry overhauls is considered departmental capital. CIP is for projects that have a lifespan of 20 years or so. So.
Well, I got you on that, but
What we did is we went from a 2-year cycle on overhaul to a 3-year cycle on overhaul.
Okay.
So that's normal. Is it about a $200,000 expenditure?
Yeah, that's what we've gotten it to, yeah.
And I recognize that 5-year piece, Wayne, as far as long-term, but I looked at this, and there are Board of Education expenses in here, which are only, or is that because of the total, that are only 1-year items,
In the CIP?
$154,000 1-year item. Yeah, in the CIP. Maybe that's because education as a whole is a 5-year plan.
Yeah, we'll sit and look at that, John. It could be that it's engineering preparation for a project that has a longer life, but I'll look at that for you. The CIP is for major capital projects.
And these could be subcategories of what you might
Correct.
consider a major
Correct.
total, schools as a whole.
Correct.
So anyway, so this is, what's the total expense on it? And I saw that, and I was kind of curious as to what was being done with $200,000, and is this part of a 3-year plan, so is it 600 total, or what's the breakdown?
Every, like, for instance, the Whitehaven Ferry, you say it goes out for overhaul next year. So it gets pulled out of the water, it gets dry docked, sandblasted, a new engine, new transmission, new hydraulic lines, everything, and then goes back in the water. So and then the next year, Upper Ferry will come out, the same thing. But then, so it's every 3 years. So then you'll have a year where there's nothing. So, it's every 3 years that each ferry comes out of the water for a complete overhaul.
So we had that $200,000 expense every 3rd year for the ferry?
Yep.
2 out of 3 years.
2 out of 3.
2 out of 3.
1 year you
Yeah.
don't.
1 year you
It's
don't.
staggered.
But I mean, for each, for one ferry,
Correct.
for one ferry, it's every 3rd
3
year you
years.
invest another $200,000.
So that's 400.
Yeah.
That's
I
been
mean,
going
these
on
things
forever.
they're running for the most part, let's just say if everything's good, if 364 days a year and 7 days, however, 14 hours a day during the summer, and I mean, they're running all the time. So we actually end up kind of exceeding the hours for
what's expected for the life of those engines. So that's the cost of doing business if we're going to have ferry service in the county.
Don't hear it, if you don't have it, you'll hear about it.
You'll hear.
And how long are they out when they take them out?
90 days, I think, is what the contract is.
So every 3 years, we lose 90 days worth of service too.
I think I think the last time, I think it might have been a little bit more than half of that. No, it all depends because they conduct soundings on the halls. So if they pull them and they do the soundings in the hall and they find that there's a place in the hall that has deteriorated and they have to cut a big section of the hall out, that certainly could take more time. Or there's other things they might run into during the repair that were unanticipated. But for the most part, that's what we expect.
Is there a
It's a maintenance point,
replacement
capital.
that can be used?
It's
that would give us
maintenance,
more
John.
life, or is it pretty much?
Is there what?
Type of replacement ferry that could be used that would give us more life?
I don't know. These are ferries that have evolved so much over the years. I would hope that they were about as good as they can get at this point in time. But
How old are these guys?
I mean, I think parts of the original hulls remain from the 60s, I believe. But I mean, the ferries themselves started back, however long, 100 years ago. So.
No, I'm talking about the units themselves.
Yeah, I think the 60s, and they've been reworked so much, they probably still have parts of the originals in there somewhere.
Actually look at what a third unit would cost, a standby unit, so that you could stagger it and rotate it. Pretty big number.
Be a good idea if we could work it out.
Yeah, because you'd never be out of service if you did that, but it's a
Always be a
pretty,
backup.
it's a pretty
If
expensive.
there's any used ones around, I mean, there's one up, I know Woodland has one, but I was wondering.
I bet they'd sell
In
it.
the country, if there's anyone.
I said, I bet they sell it. I think they've had some big problems with that.
Yeah.
Any other questions for roads? Okay.
Appreciate it.
Thank you,
Thanks
Lee.
for all you do.
No, please stop by over at Roads and we'll show you the,
I'll go by.
yeah.
Public Works in general,
Oh, yeah,
like it is? Yeah,
sorry.
that's okay.
That's just me.
You had, there was consultant services, 150,000 for MS4.
Yeah, that's part of the municipal separate storm sewer system permit. It's going to be a reoccurring expense from the county from now on. The MS4 permit goes into effect September of this year. No, I take that back, end of October. They pushed it back. We've received the NOI. Basically, what we have to do is mitigate the impervious area in the county that's located, with the goal being to mitigate it and treat the stormwater coming off the impervious area in the metro core areas. There's an outreach component, there's a public education component, there's a section for illicit discharge detection and elimination, where we have to go out and inspect all of our outfalls. Right now, what we're in the process of doing is preparing for, at the end of the first year, we have to have mapped out and documented all of our impervious area in the county, and then take that and say, okay, come up with a plan to reduce that by 20%. So the first goal is determine how much impervious area we have, and then we can start looking for opportunities to either reduce it or treat the runoff coming from those locations. And again, like I said, there's a section in the permit that requires you to do a certain amount of public outreach. There's a section that requires
Let me just get this real quick. Could you possibly, wouldn't the 200 from the WIP, from the WIP, could that be used for that?
They are related, but they're two separate issues. It's two separate programs. We certainly look for opportunities to have one project cover both, but where the WIP project is more towards the nutrient levels in what we're seeing in the bay for addressing the nitrogen and phosphorus projects. They are more about going in and installing some smaller scale treatment systems to address these issues. So if you can take a WIP project and put it in the metro core, you can start kind of claiming that little bit of double credit. but there's, the MS4 is, they define a geographic area around the metro core that these projects have to occur in, and that you have to try to address and remediate. Whereas the WIP projects, you can go out and do a project, say out on the Nanacoke, that's really not going to affect what you're doing for the MS4. Now, there's some discussion with MDE about letting, if you do a project outside the metro core, can you claim credit for it? But yeah, they're related, but not, and there can be some overlap, but not always.
Going to be overlap in this case?
In this case, no. What we need is that money dedicated to the program to go into the hardcore engineering of developing this and funding. Like I said, I can give you an example, the illicit discharge detection and elimination, where we have to go out and inspect all of our outfalls and provide that documentation to MDE. When we were developing this program, the city of Salisbury has been under this MS4 permit for several years now. They recently received an EPA audit of the program and got fined for some places where EPA felt there was deficiencies in the program. So talking with Salisbury about what lessons learned they had from the EPA audit, we're addressing those with this program. And one of the big items that EPA apparently had was when they tried to do things in-house, were the issues where EPA was coming in and finding them for it. So they tried to go in and develop their own, it's called IDDE, illicit discharge detection and elimination program. They tried to do that on their own, and they were getting fined by EPA for it. But if they spent money on a consultant to go do it for them, then they were fined with it. So again, it's trying to make sure that the county doesn't receive those same EPA fines if and when they come to audit our program.
Yeah, the only other question I had, Dallas, was in the budgeting for the benefits, that number seemed extremely high in relation to salaries. I mean, your salaries, and I'm looking at the 2019 current year budget analysis where this public works salaries are listed as 194,715. Is that a total number there?
For benefits, you're going to have to...
Benefits were 239,568, 28% increase, 150,000 of that being hospitalization. I was just curious what happened, what was going on there.
You'll have to discuss that with HR. I've had no input on the salary benefit section of the budget. I'm sorry, I wish I could answer. That's HR's.
Well, yeah, it didn't seem like, I mean, it didn't appear, I mean, we recognize the fact that there are a lot of costs that have been occurring throughout the county, increases in costs with benefits and insurance programs, what it might be, but this seemed extremely astronomical compared to all the other departments.
I'm not absolutely positive, and I think we'll have to check with Michele, but the new law with part-time health insurance goes into that as well.
Man. All right, if you could let us know, that would be great. Wow. Because that's a really huge number. Huh, part-time, yeah. Sorry?
The Fruitland Water and Sewer for 105,304. Why is the county paying that? Are we reimbursed per user fee, or is the county just paying for that? Is that for the Morris Mill project?
Where do you see that one at?
It's on page 25. There's no number beside it except 25 in the general fund.
I will have to check on that one. Can I get back to you on that?
Larry, I think that's Colbertville.
It's done.
Well, that would be the Morris Mill as well, wouldn't it?
It's done.
It's done.
This May is the last payment for the water sewer.
It said 2018 adopted budget.
Yes, FY18, FY19
Okay.
has no funding.
So we're not paying anything on that this year? Okay. Yeah, I see a minus 100%. Okay.
Any questions? Thank you, Dallas. The next department is corrections, and I see corrections is here.
All right, try not to give you lunch.
Just eliminated.
I know, I am gonna so get out of the way.
Never changed. Still fly. Cut down the trees. and still fly.
Congratulations on your new position.
Thank you, sir.
How are you finding everything?
Finding very well. Yeah, it's good to be home.
I think this should be mentioned that you were here that day when we voted on you. We didn't realize you were in the audience.
Yeah.
Otherwise, we would have recognized you then.
It's okay.
We'll let you begin, if you don't mind, just give us an overview and any new expenditures or plans that you're planning, that you're considering. And introductions too, thank you very much. If you could state for the public your name and your position, thank you.
Angela Morton, Finance Administrator.
Ruth Colburn, Warden.
Chris Tyler, Deputy Director.
Okay, thank you. I'll let whoever wants to start begin.
Okay. I apologize for coming in late on the budget year, so if I make a mistake while I'm talking to you guys, please don't hold it against me, because memorizing all these numbers in a short amount of time is a little bit beyond my country background. There was the inmate expenses line item was increased. I was told that in the past, certain items like mattresses, linens, and that sort of thing have been purchased from the Inmate Welfare Fund, which can't be done according to the annotated code, so we added funds to address that. We have some significant capital problem, or CIP, I'm sorry, I'm getting used to the lingo. We've got some significant CIP stuff in there, but if there's anything you guys have questions about, I'd be happy to try and enlighten you on anything.
The one thing I noticed was training, the external pre-service training went up by about 100%. I mean,
The turnover rate, hopefully we'll be able to get under control. Every year, the cost of sending a correctional officer through the academy does increase. And if we have a significant turnover rate, then we have to continually put them through. So I believe that's reflected in that line item.
how is the hiring going? I mean, I know that last year there was a variety of empty positions. Is that getting better, or they're still having a hard time? You're still having a hard time hiring?
It's somewhat difficult to hire qualified correctional staff, but we've got 4 on deck to come on board, and I think 2 other ones that we already brought on board. So hopefully we're going to be making a dent in some of those.
After those come on board, how many empty positions will you have?
9.
9.
Mhm.
And obviously you need, people there. I mean, so you're basically filling those through overtime. Is that how it works?
That's correct, sir.
Joe? Well, welcome aboard.
Thank you, sir.
A couple of things. One, I guess I was talking to a recent retiree, and one of his biggest complaints was, it's 5 o'clock and you want to go home and somebody doesn't show up, so you end up having to pull a second shift. Your life is disrupted, and I know that is from not having enough staff. How far away are you from having the correct amount of pay to retain people? I know that's a tough number to call.
That is a tough number to call.
I mean, are we 10% off on pay, 15% off, 5?
I would say a minimum of 10. You have a number?
No, ma'am.
Minimum of 10.
So you think to retain people and to reduce your turnover rate, take almost a 10% increase in salary to...
If we're going to try to compete with, which we...
And you are competing with them, so...
We are competing with them. I focus less on compensation and more on other things when it comes to morale. I think that little intangible things
can make conditions better for staff and make them more likely to remain. If we start getting into a race with ECI and Worcester County Jail, we know that we're going to lose. ECI has the state of Maryland, which has significantly reduced local budgets through a variety of different programs. Worcester County has Ocean City. Wicomico doesn't have that base of, and then we're a rural county, so we've got a lot of land rich, not necessarily money rich. So I think that focusing on improving the environment and working on not just the detention center, I think looking at an overall living wage for the county would be an important thing for retaining all staff. You know, figuring out that base level where a person can support their family and survive without having to get 2 or 3 part-time jobs. I don't think it's just about our department. I think it's something for the whole county.
That's a complaint I hear. It's one of the reasons folks don't stay is because they get hired somewhere else that pays more.
That is one of the reasons.
You know, and there's other departments, I guess, in the county that happens with, but there's some that don't. On your new hires, we're paying to put them through the academy.
Yes,
Do we have a program in place where if they leave after, that they have to reimburse?
They do sign a contract
Okay.
that they have to stay 2 years after completion of the academy. Otherwise, they have to reimburse the academy on a prorated level.
Okay. Do you have any in training now?
There isn't an
There's no
academy right
academy
now.
right
The next
now.
one is July.
In July?
Yes, sir.
How long does that take?
7 weeks.
7 weeks. You got somebody going?
Hopefully 7 or
7
8.
people.
7.
Minimum, yes. Been trained up.
In that meantime, you'll have 4 or 5 weeks.
Well, we'll work on that, so
Hope not.
let's hope not.
Councilman Holloway was accurate on his assessment about the pay and the future pay. We are hearing from employees. We have been hearing from employees. Matter of fact, some have come here and wanted to speak, which they couldn't at the time, but we've been contacted about not only the conditions, but the pay. And we understand they're underpaid. That's why we were asking you if you were planning anything for that in the future.
I would like to plan for that in the future, but I would like to do it in tandem with the rest of the departments within the county to benefit everyone.
Well, I understand that, but your department is the one that's contacting us, it seems.
Yes, it is.
More frequently.
Yes, it is.
What other kind of, you said you'd like to work on other things other than monetary compensation. What other things that you would see in your department that would help retain people?
I'm not a conventional person, so my answer will likely be not as conventional as someone else's. Correctional officers generally feel as though that they are invisible. No one can see them from the outside. When you feel as though you're invisible, you feel that you don't matter. So one of the most important things you can do for any of the people on the floor is to see them, to interact with them, to let them know that they're part of something larger than themselves and that they're important to the county. And also to help engage the detention center with the community, because unlike a prison, which is somewhat like an island, we are not. The folks who come in, by and large, are Wicomico County citizens, and they're going to come out Wicomico County citizens. And the more we work with the inmates and engage with the public and have the officers buy into that, the more purposeful they will feel. Other things, some of the upgrades for making the conditions inside the detention center better, of course, heating and cooling. I can get electric heaters, but trying to get air conditioning into places that are hot, that can be a challenge. So the fan coils and that sort of thing are important. At this moment, I'm still in the assessing phase. I think that there are some other things that can be done to improve morale. Different paint jobs and changing the color scheme, changing the way that the administration interacts with one another and interacts with the staff. Small things.
I think one of the biggest complaints I've heard, and of course compensation is one of them, but the biggest complaint I've heard is the getting called, having to stay when you're supposed to go home. And of course, some folks want overtime, a lot of them thrive on it, but I think that's one of the biggest things I've heard from more of the officers over there than anything. When it comes 5 o'clock or whatever time their shift's over with, they think they're going home. They think they're going home, and then 5 minutes or 10 minutes before the shift's over, they have to stay.
One of the habits that I have developed as a warden, there's a target population that we can reach that the state can't. We can hire at the age of 18, the state can't hire until they're 21. Some folks don't think an 18-year-old should be involved in corrections. If they can be drafted and die for their country, they can come work in my jail. So targeting that population between 18 and 21, if we hire them at 18, then we're going to keep them for 21 until they're 21 because they're not going to be able to go to ECI. So that gives us 3 years. And if we can just hold on to them for 2 more, then we should have them for the rest of their career because 5 years is like, you're in. So.
Is a master correction officer the highest rank you get before you get promoted? Is it like, you know what I mean?
And remain on the floor?
Yeah.
Yes.
So when the guy come out of academy, how long would it take him to obtain that?
3 years.
3 years.
Most, I think, of what you're doing are capital this year, which is probably good. Probably maybe a lot of deferred maintenance, my guess would be, which is good. Only other thing outside of that, which is almost standard procedure, I know the sheriff's department faces the same issue, and that's like overtime. You've got about a budget of $200,000 in overtime expenses. Are there concerted efforts to try to bring that number down and to change, because you do differential for different shifts, I understand. But is there any way that you make a really concerted effort to try to cut that number down on overtime? And if not, it may be something that you could think about next year or something. I'm just curious as to maybe not being new, maybe the processes in the past, what's developed, how it's transitioned. You haven't been here long enough, I think, to understand that.
I mean, the short answer to any, can we
that.
reduce overtime? The short answer is yes.
Mm-hmm.
Will it happen immediately? No. Focusing on hiring and retention is going to help stop the constant churning at the bottom, which is what generates the most overtime and causes people to be drafted. We could look at a different shift schedule, see if we can try and reduce overtime that way. Those are just my initial thoughts.
We're not familiar with that. I mean, we're not familiar with how the processes work. With the sheriff's department, I think it was learning for us as well. And that, in their situation, they have so many different people that are in different areas at different times. Corrections seems a little more consistent, that it's a self-contained area. The sheriff has to send people out to a movie theater, out to the civic center, and out to day and night. There's constantly shifting, but it seems like the corrections would be more consistent and that the overtime could be reduced. And I don't know what the standard is across the country of percentage of overtime versus total salaries. I just saw that number and thought I'd ask. And we'll give you a while to think about it.
Okay.
Maybe next year when you come back.
That should be enough time.
Is there anything, I'm sure you monitor, how many times, an employee calls out sick? Are they constantly calling out repeatedly? Is there anything done to deter that? Just causing these folks to have to work longer hours?
In order to establish abuse of sick leave, you have to establish a pattern of behavior. One of the policies that I want to put in place is that you look and look to see whether or not they establish a pattern of if they get drafted, they call out sick the next day. If they take a vacation day, are they taking one sick leave day to try to extend that? Are they always calling out on Fridays? Are they always calling out on Mondays, the day after a holiday, the day before a holiday? Once you start, you have to lay everything out for every employee and look at it over a period of 6 months to a year to actually really establish a pattern of abuse, but it can be done.
I bet you the other employees can tell you if it's being done.
Well, yes. Oh, and you also have to look at whether it's deer season, playoffs, yeah. So yes, there are plans to address that.
Yeah, we just had the roads department in here, and they were talking about using a labor crew. How well does that work? I mean, are you getting as many, and people volunteer for that? I mean, you know, because they were saying that maybe there wasn't as many inmate labor crews that they could get as in the past. I mean, can you just enlighten us on that?
Our population is down a little bit.
Geez, that's good.
That is good.
That's good.
But there's a twofold to that.
Yes. Because it's down, that means we have a smaller pool to choose from. Not everyone can go out and be considered safe to be out in the community. But that's also something we're working on looking at how we choose the people who go out and the criteria. So with any luck, we'll be able to raise that up.
Okay. Good. And people volunteer for that? Is that right? Or are they kind of volunteer? And
Well,
meet a
some
certain criteria?
volunteer, some are voluntold. Most of the people voluntold. Most of the people who go outside of the facility are happy to go outside the facility, regardless of the weather, because they're out. It's fresh air. They feel freer. So the community crews, there's a lot less voluntelling and a lot more volunteering.
And I, a cousin in another state who was in jail, yeah, he'd love to go out of the
Yes.
because you get out, you're out you're not in the facility, you know. So,
Right, staring at the same walls, looking at the same people.
The same guard.
Your budget shows almost $2 million in medical staffing, dental staffing, mental health, random drug tests. Does that fall under a contractor like correction medical services? Just wonder why it's broken down that way. Because it goes out for bid,
Yes,
and that's what you're estimating your cost would
that's
be.
what we estimate.
I got you. Okay. I guess that's the best way to do it. I think I have one more question. You go on.
Wayne, sorry, snuck up on me over there.
Don't worry about it. If I could just make a couple of comments. Ruth, as you know, has only been here since, I think, May 7th. So she's renewed to the facility because she was there many, many years ago. But I wanted to just go through a couple of things with you. Weston and I have been sitting down with each officer out there one-on-one just to have a discussion, to get a much better feel for what are the things that could improve their satisfaction with the job, what are the obstacles that they face. We're about 2/3 through, and I got derailed for a little while, basically because of the budget, but we're going to get that started up again once the budget cycle is complete. A number of things came out of that. There are certain people out there who feel that they're significantly underpaid, but I would tell you that in the one-on-one discussions that we had, there was less discussion about pay than there was about what Ruth mentioned in terms of correctional officers feeling as though they were invisible, feeling as though the community didn't really understand what they go through on a day-to-day basis, and in some cases, feeling that the administration didn't really understand what they go through on a daily basis. So I think as we try to address the morale problem, pay is certainly always a component, but I also think that we need to have what I would refer to as a high-touch environment, because when you go out into what I call the cell blocks, called the pods, the first question that you want to ask these people is how are you doing today? How are you as a person? And I think we need to do a much, much better job of that one-on-one, high-touch relationship with our correctional officers. In terms of pay, the other thing is that when we had the RIF back when, we eliminated a number of higher-level positions. So, Joe, you were asking about getting to MCO, or was it Ernie? But anyway, you get to MCO, and you flatten out. You plateau out, so you don't see a career progression. You say, I'm here, I'm an MCO, until one of the sergeants leaves. And I think we need to look at that staffing progression. So we have COs, we have CO2s. I don't see any obstacle, for instance, to us saying, okay, we have an MCO, but we could have an MCO2 as well, so that we're building in a progression where people have something to look forward to. So I think developing a better career path for our correctional officers is really important. The other thing that was consistently spoken of is just simply the nature of the detainees that we have to deal with. And the correctional environment over several years has really changed for a number of reasons. The shutdown of the state mental institutions, that whole system is essentially gone. The opioid epidemic, so approximately 80% of our detainees have serious mental health and or addiction issues, and some of the behaviors you wouldn't believe. And it takes a very, very special kind of person to be able to really cope with that on a day-to-day basis. And some people just simply can't. So the turnover, a certain amount of the turnover has to do with pay, because the state's offering bounty systems, that type of thing. But a certain amount of the turnover also has to do with just the stress that a correctional officer goes through, and they're with these people for a full 8-hour shift. And if they're held over, they're there for a 16-hour shift with people who just aren't normal people. And again, it takes a very, very special kind of a person. So I'm inclined to be looking at, okay, how do we create a higher touch environment for these officers, and try to mitigate some of the stress that they're under. Certainly we have to look at pay. Certainly I think we have to look at career progression. And the physical environment, I think we've been doing as good a job as we can, given the resources we have, to improve the facility itself. But it's a fairly old facility, and it does need capital investment. So, we will continue, Weston and I will continue to work on that with Ruth and with Chris, and be sure that we speak with every one of the officers out there and get as clear a handle as we can on what is really driving the morale or the lack of morale out there. So we're keenly aware of it.
That's good. Thank you very much, Wayne. Do we have any other questions?
I think Wayne said it well when he was talking about stress, because there was one gentleman I talked to that just retired, and I ain't gonna mention any names, but he was talking about his blood pressure, how it had improved so much, like within a week after leaving. Of course, he had rank, so he was a lot more responsible than some people were out there. And, it's a health issue, but his job was causing it to be worse, so anyway.
Larry?
Yeah, I do understand that in that department, the officers feel like they are invisible because nobody from the outside sees them or sees what they're doing, and they're amongst many inmates and they're pretty much by themselves. But I also agree that accolades go a long way. Does the department give annual awards
I don't know.
Yes, we do. As a matter of fact, our Officer of the Year right now is Officer Aaron Handy. He was selected by his peers and by the staff, the higher command staff as well. So every year we do have an officer and/or employee of the year.
No other awards then?
No, monthly. We do an officer and/or employee of the month as well, who are submitted by your peers, or anybody actually can submit a nomination. And then they're reviewed and.
I think that goes a long way.
We do, yes, we do that, absolutely. Of course, with Correctional Officers Week, we have activities every day of the week for them as well.
And when is that? Is that coming up?
That was the first full week of May.
When you made reference to the 85% of people that had mental issues, and I know that we have resources in-house, but are any of these people moved to different facilities, and are they moved frequently because they are such a deterrent or such a detriment to what you're trying to accomplish?
We will move any inmate that we need to for the security of the detention center.
Does it happen frequently?
Well, not in the 3 weeks I've been there. In my experience, inmates tend not to be moved for mental health issues, except from a detention center to an institution if we can get them in. Because no detention center, wherever it is qualified to treat mental illness. We just try to maintain them, and any place that we send them will run into the same problems that we have and send them back.
Okay, so you don't have a chance to pass any of these problems on then, do you?
Not very many, no.
You're the last stop.
Pretty much, yeah.
Great.
Any other questions? Any comments? Additional?
I thank you guys for the opportunity and for being patient with me because I don't know anything.
We understand.
All right, thanks a lot.
Thank you.
We know less.
Yeah, we know a lot less.
Come out anytime, invitation's always open.
Laura, anything else we need to bring to the council's attention this time?
Just a reminder that we do have 2 budget recap sessions scheduled for next week, May 30th and June the 1st.
May 30th and what? June what?
And then we have a special legislative session for June the 15th, and that would be to adopt the budget.
Okay.